We do not have formal votes on action except to potentially give direction to staff. Mostly an opportunity just to learn and to have a general discussion about the topics on our agenda. Speaking of which, that agenda is available on the city's website. And after each one of the items, and there are 7 items on our agenda tonight, there will be an opportunity for public comment by calling into this phone number. You might want to write it down if you're interested, 237-6196, as well as a final opportunity at the very end to comment on things that are not on our agenda. So with that, we'll get started. Before we jump into our first item, which is our COVID-19 update with John Felton, our Yellowstone County Health Officer, I just want to recognize 2 things. First is last week we lost a former city council member, Jack Johnson, a friend to many of us. Jack had tremendous patience, as evidenced by the fact that he spent more than 30 years teaching junior high kids. He was a real gentleman who was quick with a positive word and very slow with criticism. So we will all miss him. And in 2000, I believe it was, Jack suffered a heart attack after one of these council members, a phenomenon that I guess I'm surprised doesn't happen more often, given what we have to go through some nights. But he bounced back and continued to serve in his duties. So to Jack, thanks for your service to Billings. We'll miss you, and your family has the greatest condolences from this city council, I'm sure, but also from all of Billings. So Jack Johnson. Finally, our first item up is our COVID-19 update. And I was out and about this afternoon in our community and had some observations. One is there's a real sense of optimism. I think our infection rates are down, even though that our 7-day average is still in that dangerous red zone. And I guess it's seeing the glass a little bit half full, but 10 to 20% of our population now has probably been infected by the disease, which creates a natural immunity for that group, and probably another 10% that have received a vaccine. All of that can combine to slow the spread of the virus going forward. And that's produced some positive results. So our economy is coming back strongly. People are in the stores, restaurants, but there's also some negative results of that. I noticed today fewer people wearing their masks. Restaurants, some have dropped their mask signs and put a lot more people in closer proximity to each other, even though the mask mandate continues in place. And also under Governor Gianforte's directives, the CDC guidelines still apply, which require that 6-foot separation. So let's be careful. There are dark clouds on the horizon. As many of you know, we continue to see nationally roughly 3,100 people die every week from COVID-19, 179. We had a more recent death here in Yellowstone County, so just in our own community. And there's now 4 or 5 variants circulating, and we don't know how they're going to respond to the vaccines. They tend to be more infectious, and so there's real reason to maintain our precautions. And I encourage that we all remain vigilant and that we continue to do what we know will slow the spread of COVID-19, but also these variants and also even the flu. Wear that mask, keep your distance when indoors, reduce your contact with non-family members. And if you do have any sort of symptoms, don't go out and don't go to work, and get tested as soon as you can and wash those hands. With that, I'm going to turn over to John Felton, unless Chris Kukulski, our city administrator, if you have anything before. No, thumbs up. So John Felton, our county health officer, it's all yours.
Thank you, Mayor. So for the rest of you, what the mayor said, it's been nice seeing you. He pretty well summed up our situation. I, of course, have to take more time than that. So let me share some pictures with you here. Do we see that? So far, so good?
Yep.
And I'm going to go full screen with that. Do we see that okay?
Yes.
Okay, thank you. I'm going to give, okay. So just to show you where kind of what we continue to see, our rates are down, as the mayor said, statewide. This is the state new cases by day. The orange bar line being the 7-day average. Here's a little bit of a bump after Christmas, but it didn't persist. So we didn't see a significant post-holiday surge. So we all felt good about that. Yellowstone County looks a little different. I'm going to talk about this a couple times here. You saw this, there's our same little post-Christmas bump. We came back down here to nice lower levels we haven't seen since September. And then the last few days we saw this increase. Now, I want to particularly point out these 4 days right here. There's actually 209 cases that were old cases. And they were identified through some reconciliation where there was some reporting problems. For the most part, we knew about those cases. Some of them go back as far as October of 2020. But there's issues with the reporting between labs or lab clearinghouses and the state. So when a lab gets a positive result, the local public health agency is notified. That initiates case investigation and contact tracing. And then the state gets involved, and that's what I want to start to show up on the maps. So there was 209 cases that show up right here in these 4 days. The last 2 days we're back down to just new cases. So you can see this pretty significant increase here really is driven by those days right there. You see the same thing on this. Again, the orange is the Yellowstone County 7-day average of new cases. The blue is Montana 7-day average of new cases. The gray line is our proportionate share. And again, our share of the population is 15 or 16%. And you can see for a pretty good time we were down here. The last few days we've seen this jump. And again, this is largely related, significantly related to those 209 cases reported over a 4-day period. So 50 cases a day. If we look at on a weekly basis, again, here's our peak back towards the end of November. We worked our way down. We were down below that red line mark. This last week, as the mayor noted, this jumped up quite a bit. But if we take out those 209 old cases, and again, let me just say here, those are real cases. They need to be put in the count. The only way you could put them in the count is add them in as a new case on a particular day. So it's not that they weren't real. They really did not have much impact currently because they're old enough that they'd all been investigated. The vast majority of those are completely out of isolation by now. So if we take away those 209 old cases, and again, that we have to consider that philosophically or theoretically, if you will, that dropped us down to 23.1 new cases per 100,000 per day. So again, we're kind of down here in the same place we've been, but we do need to account for those 209 older cases. As we look at month by month, you can see we had this growth from July all the way through November. So for a 5-month period, we grew. We came down in December and farther down in January. So we had 1,100 fewer cases. We had a reduction in cases per day of 35, and we had a reduction in cases per 100,000 per day of 21. This does include, these data points here do include those 209 cases. So if we take those out, because they're, again, we can't really take them out because they have to be accounted for, but they're old. So we had gone from 2,700 down to 1,400 new cases. We'd have gone from 88 to 46 cases per day, and we'd have gone from 54 to 28 per 100,000 per day for the month. Even with those extra cases, we made pretty good progress. Without them, we did even better, of course. The other place that's been really important and very helpful has been the inpatient census for our 2 hospitals. So here's our peak back in November at over 150 COVID inpatients per day in the hospitals. the point we are now, we're actually down under 40. And you have to go all the way back beyond August to get a time that we were less than 40 COVID inpatients in our 2 hospitals. So that burden has really reduced as we've seen these case counts come down. When we look at where those patients come from, again, it's still the same. They're about half from the region, about half from Yellowstone County, as we would expect given our past history. When we look at kids, so these are our school agers. I've said before, we tend to sit right in this 12 to 15% range, and we're staying right there. Nothing has really changed that. Again, this 1 week that it was lower, this is the week between Christmas and New Year's. But when you look at the other weeks, you can pretty well bet they're right in that 12 to 15% range very steadily, which really means our schools have done a nice job. I'm not sure it qualifies as eavesdropping, but I was on the call or on the Zoom earlier, and Councilmember Joy was talking about, early on we were told, you shouldn't open schools. They won't last 2 weeks. They're definitely going to close. Our local schools across the county have done a really good job of keeping kids safe and keeping schools open. Now, when we look at the total number of cases or total proportion of cases in that school-age population, we went from that 10.5% up to about 13%. And for months, we've been really steady at this 13%. And that makes sense when you think that every week we're in that same 12 to 15% range. Again, evidence that our schools are doing a really good job. Test positivity, we'd like that to be below 5%, but between 5 and 10% is yellow status. You can see that for 5 of the last 6 weeks, we have been below that. This only goes through the week ending January 23rd because, as I mentioned before, this data point comes to us from DPHHS in Helena, and we get that report on Tuesdays. But you can see really a nice lowering of the levels of positivity. This is a great leading indicator for what hospital census is going to look like. If we go back here to this 22%, that's about 2 to 3 weeks before we saw those big numbers of hospital inpatients. So this bodes well for us in the burden on our hospital systems. And then just as I've done the last few times I've visited with you, here's what we look like if we compare COVID to flu. We still don't have any confirmed flu cases in the state as of the last report that I've seen. But in about 10 and a half months, we've had over 15,000 cases. That's roughly 3 times what we got in 5 years of influenza. Compared to a typical year, it's 14 times as many cases. And again, this is less than a year. We've had 179 deaths, as the mayor mentioned. That's 8 times the total for a 5-year period and almost 36 times this single year rate. And there's, we're still staying at that 1.2% mortality, which is 2 to 3 times what we see in flu. So this is definitely something different. In current restrictions, there was a little bit of talk about this. The mayor mentioned this. Hours of operation, capacity limitations, and group and gathering size limitations have been removed by Governor Gianforte. The masking requirement still is in place, the same one that Governor Bullock put in back initially in July and then expanded it in November. We would anticipate that masking requirement will probably be finishing up in the not too distant future. The 2 things Governor Gianforte said needed to happen in order to remove that masking mandate. One was that vulnerable populations were being vaccinated. As you've heard, we're getting vaccines out pretty much as quickly as we get them. And we are working on that 1B population, which is that highest mortality group. And then also a COVID liability protection bill for small businesses, schools, churches, and nonprofits. And that is working its way through the legislature fairly expeditiously. So I would think that in the not too distant future, we'll see that masking requirement removed. As the mayor mentioned, we still need to follow the CDC guidance, which is really distancing. Masking is still important, even without a mandate. Hopefully, a lot of us will continue to wear our masks and keep our distance. We are seeing certainly more economic activity as people are out and about more. Last thing I'll mention is vaccinations and vaccine. We're still where we were a couple of weeks ago, so we're in 1B. So that means that all the 1A people, which is forward-facing or patient-facing healthcare providers, as well as first responders and long-term care residents, they're still available. And then 1B is anyone over age 70, anyone 16 to 69 with one or more specific underlying medical conditions, and Native Americans and other persons of color are also eligible under 1B. The supply and demand situation has not changed appreciably. We got a little more supply this week. We got a little less last week because it was St. Vincent's turn to not get any Pfizer vaccine. There was some discussion about the number of calls. Billings Clinic has reported that their phone line to do scheduling for vaccinations was hit over 90,000 times in a 5-hour period last week. I can't remember if it was Tuesday or Wednesday. But a lot of those, of course, are people who would hang up and redial, hang up and redial, hang up and redial. But still, the system got hit 90,000 times in a 5-hour period. When we're getting a couple thousand doses a week, you can really see that the math doesn't work very well. We believe there's probably 50,000 people in group 1B. And so when you're getting only a couple thousand first doses a week, obviously it creates a real problem. We're still scheduling these vaccinations. Right now, we are doing Billings Clinic, St. Vincent Healthcare, and Riverstone Health are administering their own vaccines as they come in. With these low supplies, that's relatively simple to do. We do have a vaccine team that is putting the final touches on a plan to expand into larger community vaccination sites when we have the supply to support that. And this is how you can sign up. It's a little bit different from last time I talked to you. St. Vincent Healthcare now has a vaccine notification sign-up form. You can see the email or the website address there. And then there's a notification when an appointment is available. You can also make a phone call to St. Vincent Healthcare. Once those appointments are filled, then you'll get a recorded message. So if you get the recorded message, what that means is there are no more appointments this week. Because the vaccine supply remains uncertain and variable, we can't really schedule more than a week at a time. And I know that's challenging for people, but we don't want to schedule someone and have to call them back and say, sorry, we didn't get vaccine, so we need to cancel your appointment. So when you get that message that the appointments are filled, that is really it. There's no more appointments that week. Billings Clinic has two ways: one through their patient portal, and the other via phone numbers. And then Riverstone Health, Public Health, there's an online form, and we also hold back a certain number of doses for people who call. Once those appointments are filled, then you get the same recorded message. So overall, things continue to look better. I realize that the numbers this week may have made some folks a little nervous. I want to reiterate that those old cases are real cases. The only way to get them into the state's database is by reporting them as new cases. But really, there's almost half of the new cases for the week were old cases. Most of those, if you notice, even at the increased number of cases, you didn't see much change in terms of big growth in the number of active cases. That's because all those old cases were open and closed at the same time. They never hit the active case line because they were closed as soon as they were open. So now we are back to the best of our knowledge, all of the old cases have been entered. And again, this is really a reporting issue. So when there are positive cases, local public health is notified, and we do the case investigation and contact tracing at that time. So even those cases that just hit this week, they'd already been fully worked up at the time the test was positive. So it doesn't mean that any people weren't taken care of. It's really just an issue of the reporting process that occasionally breaks down, and some of the interfaces occasionally break down. So with that, I will stop, and I'd be happy to answer your questions.
Thank you, John. And sorry I left you momentarily. My computer went black again. Councilmember Ronnie?
Thank you. John, can you clarify, because I think tomorrow, Tuesday, the CDC federal mandate for all forms of public transportation for mask wearing, that goes into effect tomorrow, correct? So airports, buses, things like that, anything that's public transportation, there is a mask mandate, correct?
Yeah, I haven't actually seen the mandate yet, so I don't know if it only applies to those that are regulated federally, or if local public transportation is under that as well. So, we usually will get, as soon as those things get officially published, they'll come to us from the State Health Department, and we have not seen that yet. So I'm not sure exactly how extensive it is. Certainly the airports and interstate air flights are regulated federally, so they are covered. I don't know if it addresses things like local public transportation. I have to see the order first.
Okay, thanks, John.
Thank you very much. Other questions for John? Councilmember Ewald?
Thank you, Mayor. I got a couple questions for you, John. So I'll just ask them and then you can answer them. Who determines how many spectators can attend an athlete's sporting event? And the other one is, whose science regulates whether wrestlers cannot shake hands before and after a match?
So for school sports, that is under the auspices of the district itself and the Montana High School Association. Governor Bullock made quite clear that because school districts have to address both the academics and the activities, that they are able to make those decisions. So I do talk with the school superintendents on a weekly basis. We have talked a lot about the increased interest in things like regional basketball tournaments and things like that. And they usually will run by us here, at least their plans, but the actual decision rests with the district and the MHSA.
And my last question, whose science determines that wrestlers can't shake hands before and after a match?
I don't know, there is science to that if they're going to be wrestling anyway. The decisions are made by MHSA and the districts as to how they actually process those matches.
Okay, thank you. Other questions for John? Councilmember Neese?
Thank you, Mayor. John, that late data, how long will it be before it's out of your reports where it actually won't be affecting the numbers we're seeing?
We put those in on the reports for, I think it was Tuesday, Wednesday, Thursday, and Friday. It was either that or Wednesday through Saturday. I don't remember which days it was. So it takes 7 days for those to fall off on that 7-day average.
Okay, thank you.
So by the end of next week, all those cases will be out of the system in terms of what these numbers look like.
Okay, great. Thank you.
Thank you. Any other questions for John? Don't see anything. So John, thank you very much. Much appreciated. Very informative. We'll see you in a couple weeks.
All right. Thank you all.
Okay. Thank you very much. I do need to make an opportunity for public comment on that item. That phone number, 237-6196. If you're listening and would like to be heard, call that number immediately, 237-6196. Please keep your comments to less than 3 minutes. Please tell us your name and address up front. Please turn off your television or your computer or mute them because our meeting is ahead of what you're hearing and it'll be very confusing for everybody if you don't do that. 237-6196. We'll delay briefly to see if we have any calls to that number, 237-6196. Denise Bowman, our city clerk, do you have any calls to 237-6196?
No, Mayor, I've received no calls.
Okay, thank you very much. We'll close the public comment period then and move on to item number 2, legislative updates. City Administrator Kukulski.
Excuse me, Mayor.
Councilmember Neese.
Thank you. Just a clarification on the order that was the agenda I had, of course, didn't have a public comment, which was fine. We didn't have public comment for item number 1, but my item numbers that were sent to me by the clerk were off. Did that get corrected?
Good question. The paper version they should have been. Our paper copy was lower than they should have been by 1. Denise, do you know whether that was corrected on the online version?
Yes, it is.
Okay. Thank you.
Great.
You're welcome.
So, Chris.
Yeah, Mayor, Council, thank you. And thank you for Kevin for filling in. He obviously did a great job. I was looking not to do any more council meetings. You guys were done by 7:00. So Kevin is going to be taking care of business in the future with you guys. And I'll try to stay in Helen in the next 3 months. But on a serious note, we did in the weekly, which I apologize, didn't go out until this afternoon. Winette got that out for me, so you got a little bit of information there. But for this week's hearings, so House Bill 259 is a revised property and zoning laws. Wyeth is going to be testifying there. It's 3:00 tomorrow. It's a bill that prevents cities from allowing inclusionary zoning. So the League of Cities, the Montana Planners Association, and most cities, mostly out of a local control issue, most cities, very few cities in Montana have inclusionary zoning. So on the one hand, it may be somewhat moot, but not really, because what we don't like is they're telling us you can't do it. I don't know what our desire might be 5, 25, or 50 years from now. So that is tomorrow. That's House Bill 259. Then we also
I
have
apologize
House
for
Bill
interrupting, Chris, but maybe you could just explain what inclusionary zoning is, namely government's ability to
I'm sorry.
something be included as opposed to excluded. Is that right?
I'm sorry. Thank you, Mayor. Yeah, so a governmental forced mandate of inclusion for various zoning types being put together. Wyeth could probably do a lot better job than me in giving you a high-level description, but as the mayor explained it there. Wyeth, anything you want to add to that?
Thanks, Chris and Mayor and Council. Not much. It's usually specifically tied with housing and trying to make sure that a community is able to meet the different types of housing needs that it has, and for different income levels. That's usually when you're talking about inclusionary zoning, that's the focus. So that's what it's about. And as Chris said, we just went through Recode, and that topic was discussed very briefly early on and was clearly decided the community was not interested in going there at the time. But the concern is that these are all tools and things that the community at some point might want to use. And so the concern is just being restricted from even being able to have a local discussion about something like that and a decision. Thanks.
Back to you, Chris.
Thank you, Wyeth. So next up is House Bill 257. It is also has a hearing tomorrow. We will not be having anybody testify on it. It's revising laws related to governmental mandates for businesses. And House Bill 257. So we will not be testifying there. The League is in opposition to it as it impedes private business ability to conduct business. It prohibits any actions at the local government level. So again, state wanting to dictate what can and cannot be done at the local level. And it just remind folks, whether we think things are popular today or not, I can't tell you what will be best for Billings, Montana 40 years from now, let alone 5 years from now. And as they do these restrictive things, it tends to never roll back the other way. But we will not be testifying. House Bill 2, revise the Montana primary election date. So that's the primary election date. And the city will not be testifying for against that. I think the idea there is to move the primary up from today, it's in June, to March in Montana. Senate Bill 161. And I'm sorry, why am I bringing up each of these? Our lobbyist group, Greg and Amy, asked if we would want to testify on or sit back neutral or say anything. So next up, Senate Bill 161 allows for certain subdivision to qualify for expedient review. We do have some concerns there of limiting a 35-day window. 35 days is pretty tight. Now, I will tell you, recent, I think the last session or 2 sessions ago, it kind of went the other direction on major subdivisions, allowing as many as, I think, 80 days. We still in Billings have stuck with a 60-day rule for ourselves, our own kind of internal regulations. So just because they move it up or down, we have to be in compliance, but it doesn't mean we can't be quicker than them. But 35 days would be pretty challenging and maybe present more problems for the development community, at least in some of our larger towns like Billings. So Wyeth, I believe, is going to testify there, and that is Wednesday. Next up, House Bill 201, revise prevailing wage district laws and dispatch city designations. We will not be commenting on House Bill 201, and the league is monitoring it. And a couple of bills there. Former council member Friedel has got Senate Bill 127 on appointing municipal judges, requiring an election, not being able to appoint part-time. We've not weighed in there either. I've been playing phone tag with the judge to see if she's got any feedback for us. And then Senate Bill 78, that was going to eliminate the ability to use taxable value as a calculation method for districts. That bill, as I understand, has been tabled. And so we don't anticipate that will move, but being tabled doesn't mean it's dead, but it has been tabled. Senate Bill 77 has not been tabled, and it's not been scheduled for what the next steps are either. And that's the bill that would be fairly restrictive or add quite a few more regulations around the creation or continuation of districts. In our case, our Park District 1, but it's not only park districts, it affects many districts around the state. That's really the update at this point. So really some land use activity this week that we'll be weighing in on, nothing overly specific. And then maybe I will touch on, we are in draft form. Why I wasn't here last Monday night. We are working with some of our local legislators, as I mentioned in the weekly, specifically to regulate once a court case is fully adjudicated and an individual who's incarcerated belongs, and I don't know that I'm using the right terms here, so please give me a little grace there. But if they are squarely in the custody of the state of Montana, if they do not move them out of our local jail, not just ours, but any local county jail, and onto a state facility within an allotted period of time, we're looking for mechanisms to allow the county attorney to make a request to the judge that the Department of Corrections explain why they haven't moved those folks. And bottom line is, what we're trying to do is open up space in our local jails to deal with our own local challenges versus have them full of state incarcerated individuals. The other area we're not as far on, not as specific on, but working conceptually on has to do with regulations or issues related to parolees, and working with the Department of Corrections and the administration on increased numbers of parole officers and support that individuals would have in Billings, while at the same time also pointing out that we believe statistically we're getting a way disproportionate number of parolees in, and the entire state, each county should be looking at what are their services and what are their needs to meet that need, rather than for Yellowstone County and Lewis and Clark County to get a very disproportionate share relative to the state. So I'll hold it at that. Mayor, happy to answer any specific questions if any council members have them.
Thank you.
Thank you.
Councilmember Purington.
Just a quick clarification, Chris, on the jail incident, moving them out of the jail. Is that city and county?
Yes, it would be. I mean, once they belong to the state, again, for lack of a better term, that they would need to be moved out or explained why they're not being moved out of the jail. I'm not sure. Am I answering your question?
Well,
I don't think of city.
Well, we don't have a city jail anymore. We have county, but I would imagine that other municipalities within the state have city jails that take some of those prisoners, or do you know?
Actually, I don't think there's any city jails left. I think they are all at the county level. Our work would be to help in both regards. We're working in concert with the county sheriffs in that regard.
Thank you. Other questions for Chris? Any other questions before we go to public comment with that phone number 237-6196? Don't see any, so let's open up for public comment. If anybody has a question before we conclude this item, that feel free. But if you're listening and you'd like to comment, please call that number 237-6196. Please, again, keep your comments to 3 minutes or less. Tell us your name and address up front. Turn off or mute your television or your computer. 237-6196. Denise, do we have anybody who has called 237-6196?
No, Mayor, I've received no calls.
Okay. If you see somebody in the next few seconds, please let me know. Any other questions before we move on to item number 3? Seeing none, then we'll continue and close the public comment period. Item number 3 is the 2018 Long Range Transportation Plan. This is kind of transportation week here for the next couple items. I believe that Scott Walker, our transportation planner, is our presenter. So, Chris, unless you or somebody else has something to introduce this, we'll turn it over. Wyeth, thumbs up. So we'll turn it over to Scott. Scott Walker, it's all yours.
Okay. Thank you, Mayor and Council. Let me share my screen here. Okay. All right. This is actually an update of our transportation plan. It's the second one of these that actually we've had to do in the last, 6 months or so. But as an introduction here, our transportation plan is really our major document, that lists all of our transportation and transit and highway projects, actually, as well as bike ped. And from time to time, we need to amend this document to add or revise projects that come up, either that they are new projects or that they are projects where dollar amounts have changed in some way. And in this case, we're amending our plan to include our bill grant. And if you remember, late last year, we were awarded a bill grant from the federal government, and that was to complete our Inner Belt Loop and our Skyline Trail. And you can see the dollar amounts associated there. This is basically a list of the changes that we made in our long-range transportation plan. And if you remember, our long-range transportation plan's quite a beefy document, so I did take the liberty of just giving you sort of this quick reference sheet instead of the whole document. But you can read through there, and we've basically updated all the tables and charts that needed to be updated to include the build grant and subsequent costs. Again, we're doing this because we have to show in our federal documents where we are spending federal money. And this is a simple amendment of that our long-range transportation plan, and pretty straightforward. As far as our review schedule here, our technical advisory committee reviewed and made a positive recommendation back in December. Our planning board made a positive recommendation on this document last week. The commissioners will act on this actually tomorrow, and this will be in front of you at your council meeting on the 8th February, and then goes to PCC on the 16th. And with that, I can certainly answer any questions anybody has.
Thank you very much, Scott. Sounds like really just a technical item, but maybe there are some more substantive questions that members of the council have. Scott, I'm going to ask you to collapse your screen, then I'll be able to see council members. Did anybody have a question for Scott? A reminder, this item will be on our agenda in 1 week for formal action. But until then, are there questions for Scott?
Mr. Mayor, it's Pam.
Councilmember Purinton.
What does PCC mean?
That's our policy coordinating committee. And that's basically the mayor is the council's representative. It's also made up of the chair of our county commissioners, the president of our planning board, and Rod Nelson from the Montana Department of Transportation.
So if any time the council has a direction or problems or any message they want to communicate to the PCC, please communicate that to me so I can communicate that to the PCC.
That's
the required
exactly right.
body required by the federal government of that those groups to coordinate these transportation decisions. So it's a federal requirement that there be a PCC. My understanding.
That is correct, Mayor.
Councilmember Neese.
Thank you, Mayor. Scott, you mentioned mainly this was a lot of this update was due to the build grant, dollar amounts, where it's going. Did you update any kind of timelines in that? And then can you describe what those timelines are if you did? Not exactly. In that some of the timelines of both the Inner Belt Loop and the Skyline Trail, it's going to be a sort of a varied timeline, or a two-tiered timeline, actually. I can tell you that the Skyline Trail may move a little bit faster because a lot of the engineering already has been done on that particular project. Inner Belt Loop, it will lag behind a little bit. The short version of the story here that we still have to get an agreement from Federal Highways. When that happens, we'll fill out that paperwork and get that sent in. At that particular time, they will officially approve the expenditure of funds. When that happens, we can move forward full blast on both of these projects. Right now, and these are just estimates, the Inner Belt Loop probably will take from 1 to 2 years to complete, or excuse me, the Skyline Trail from 1 to 2 years to complete, and the Inner Belt Loop might be on the 2 to 3 year time frame. Yeah, that's kind of what we know today. Again, nothing etched in stone here. Okay, Mayor, quick follow up on that,
please.
Yeah, that's different than what we heard from our city, Deb Melling on that about 6-8 months ago. So, but are you saying that we have not got the paperwork from the federal government yet approving or finalizing the build grant?
We need to receive what they call an agreement between our community and the federal government. We have not gotten that yet. Until we do and work through that agreement, we're waiting.
Okay. Is there a
Quite
hold up
honest.
that somewhere in the federal government that one of our representatives can assist on that, or is it just?
We're working. We're working with our Federal Highway Administrative Liaison in Helena. We're in contact with him several times a month. He's keeping us up to date on what he knows, and we just don't have anything at this time.
Okay. Thank you.
Hey, Scott, if I can follow up on that.
Mayor,
Okay, Chris, go ahead.
I'm sorry, go ahead, Mayor, and then I'd like that. We were on the phone today with David Church's staff, so I'll share his perspective on this as well. Go ahead, Mayor.
Okay, thank you. On that issue of the Skyline Trail engineering, Scott, most of that engineering has been done, but all of it has not. I don't know, maybe it's 70, 80%. Where are we at that? Are we having discussions with the firm that did the original engineering, or will we be going out for contract for the completion of that and contract management? Or do you know, and can we keep that ball moving now as much as we can?
Yes, Mayor. We're definitely keeping the ball moving. The only thing we're sort of working through now and finalizing would be the engineering of the parking facilities, the parking lots. The engineering for the entire path basically has been completed. We are also, the only other thing that we're waiting on is the geotechnical information that has to be done at the request of the Montana Department of Transportation. But all these things are sort of moving along simultaneously. So we want to be ready to certainly move everything forward as quickly as possible when we get that agreement.
Okay, thank you. I'll just tell you, I've had conversations with some of the landowners to the north that would love to have a pedestrian underpass to be able to connect the property on the north, which will be developed with time extensively to the trail system. Unfortunately, that's a little more expensive than just putting in a 12-inch culvert, I imagine. So that's something to keep in mind, maybe with the engineer. Maybe there's a way. Councilmember Yakwich, and then back to Chris Kukulski.
Oh, if Mr. Kukulski wanted to touch on that, that's fine.
Yeah, maybe before Chris, you might be frozen. You still with us, Chris Kukulski? Or is he just fallen asleep?
I think he's frozen.
I think he's frozen too. So go ahead, Councilmember Yakwich, and Chris will
Thank you, Honor. Thank you, Council. I wanted to follow up, Scott, with what Mr. Neese brought up, and in line with what the mayor is asking about the ball rolling for the Inner Belt Loop. We do have gas tax money. Are we engineering? Are we getting all this lined up so we're not just waiting for paperwork? So when paperwork's done, we can just rock and roll. Where are we at with that?
Yeah, my understanding is that our Public Works Department is working diligently on some of the details of especially the Inner Belt Loop. That's what I can tell you. That's about as far as I can go as far as what their progress has been with some of the details of the Inner Belt Loop. But I do know, our intention here is certainly to move forward diligently with what we can do before the agreement, and then as we get the agreement and get that signed off on, we'll be ready to go with whatever bits and pieces of both projects are ready to go at that time. I think that's fair to say.
Your Honor, just to follow up on that, if I'm out of order, let me know, but Ms. Melling is online. I'm just curious, are we doing what we need to do before the paperwork so we can just go forward as quick as possible?
Debbie, our Public Works Director.
Thank you, Mayor and Council. Yes, we are proceeding with the design. However, when I presented a few months ago, a few of the things that I talked about that we needed to get done, one, we have to figure out how we're going to fund water and sewer for this corridor. We're working on that. We meet every couple of weeks, and we've come up with plans. We're trying to put together how we can have development participate with us in some of these extensions, what we would have to do to extend our own systems to get to those points. And then we're also working on new appraisals, which are underway for the right of way for the corridor, and then getting to that point. The other piece of it is obviously the zoning and the discussion about how that development's going to occur out there. So all that's going on simultaneously. We are moving forward on all of that.
Thank you.
Okay, thank you. Chris Kukulski, are you back with us? And then we'll look to Councilmember Ewald. I don't see Chris. He'll be back, I'm sure, later. Councilmember Ewald?
Thank you, Mayor. I thought that that inner belt loop was a 4-lane planned highway, two of which would be built now, and the water and sewer would be in the 2 lanes that aren't being built now. So there should be no holdup on getting the actual road or the inner belt loop built for traffic, which we need desperately in the Heights to get out of.
Debbie, you want to comment?
Sure. The constructability issues are exactly like you said. There's 2 lanes that we'll construct now, and then the water and sewer can be outside of those constructed areas. However, we have to make sure that we have a plan for the water and sewer. We're already hearing from development that as soon as that road goes in, they want to start developing. We have to have a way to get them utilities so that the development occurs in the city, not in the county, and in a way that we can manage the growth versus having it just happen without anything, any planning or any utilities in place.
Thank you. Anything else for staff before we open it up for comment on item number 3, that phone number 237-6196? Do want to hear from our city administrator, but he's obviously having connection problems. While we wait for him, why don't we open it up for public comment? That number again, 237-6196, 237-6196 on the long range transportation plan, item number 3. Please keep your comments to less than 3 minutes. Tell us your name and address. Mute or turn off your television or computer because our meeting is actually ahead of what you're hearing. And it's very confusing if you're hearing one thing from the screen and another thing from the telephone because you called 237-6196. Denise, do we have anybody who's called 237-6196?
No, Mayor, I've received no calls, but I am communicating with Chris, and he said his computer is rebooting. So as soon as he can get back in, I'll let him in.
Okay, please do that. And even if we've moved on to our next item 4, we'll maybe ask Chris to come back to this item. So, sorry for that interruption, but is there anything else before we move to item number 4? Don't see anything. So we'll close our public comment period, not having heard anyone on that. And we'll move to item number 4. Back to Scott. It's all yours on the draft 2024 Transportation Improvement Plan. Also a similar amendment here, I guess.
Exactly, Mayor. Thank you. This actually is our first amendment of this particular document. As you remember, our 2020-2024 Transportation Improvement Program is our fiscal document that tracks how we spend federal money, both highway and transit, in our community. And for a little more background here, again, periodically when we have changes in costs or projects, we need to adhere to those federal requirements and go through these kinds of amendments. Let's see. The 2024 TIP basically looks like this, and again, there are quite a few changes in this document, but I thought I would highlight some of the bigger new ones. And we did this. There's kind of threefold here. As you can see, the first bullet point, we've amended this document to show the build grant information that you just saw previously. Also, at the request of the Department of Transportation, there are a couple of other new projects that they have added in. And so on behalf of them, we are advancing these two projects. And it's the Montana Avenue overpass for initial study and then rehabilitation. And the Grand Avenue from 24th to Zimmerman as a pavement preservation project. Those two projects have not been in a previous TIP, so they would need to be included in this. The third thing that I wanted to make you aware of, and I know Rusty Logan is on, he might have a couple things to add about Met Transit. They were awarded some money out of the AWARE program to enhance their transit system. And Rusty, you want to speak on this?
Yeah, actually, so the Met Transit, we've got a couple different ones here. So the AWARE section of that was actually a van that was awarded to AWARE locally here, an organization that focuses on assistance for individuals with disabilities through that 5310 coordination program. We did actually end up awarding a vehicle to AWARE to meet some of their needs here in town, fulfill some ADA service requirements on their end of things. We also added in, since we were doing an amendment here, we added in our CARES Act funding that we'd received previously this year. So many of council members you're aware of, we did utilize a large portion of that CARES Act funding to purchase additional replacement buses. And we also we moved forward with bus technology procurement, that electronic fare system. So really that's the whole impetus for the amendment was that electronic fare system, because it did fundamentally change the function of the system here at Met Transit. So at the same time, we took advantage of the fact that we needed to amend and added in these bus purchases and facility improvements. Thank you, Scott.
You bet. Thanks, Rusty. We also, through MBT, we took this time to update a lot of the other project costs that are in the document. There's quite a few projects in there, and we went ahead and refreshed those project costs. This particular document is on the same time schedule as the past one. Our technical advisory committee reviewed it back in December. And the City Council will make formal recommendation to our PCC at your regular meeting next week, and then we'll go to PCC on this on February 16th. And with that, I can answer any questions on this document.
Great, thank you very much, Scott. I'd like to go back to Rusty while we've got you. Rusty, I wonder if you can just explain the electronic fare system. I believe at one point you had to go to Met to get a pass, which is difficult if you don't have transportation, or you could use cash, which for a lot of younger people is a four-letter word. They barely know what it is. So how does the electronic payment system work?
So we, Mayor and Council, thank you. We partnered with a vendor called TouchPass to roll this system out. It's actually got two different components that passengers can utilize. They can either use a smart transit fare card, which we do have available here at the Med and currently at City Hall, or passengers are able to sign up for an account on their phone. So now once passengers board the bus, they're actually using either their phone to scan a QR code on a reader that's installed in every bus, or they're using that smart card to simply tap against it. So it's actually allowed us to make a number of improvements to the way that we collect fares as well. We have a system in place now which is referred to as fare capping. So that means an individual can pay up to the amount of a 31-day pass, and at that point they're automatically awarded it. So say an individual with disabilities that comes in and pays for a one-way fare multiple times across a 2-week period, once they meet that $12 31-day pass cost, the application would automatically update them to that 31-day pass as well. So we have added in some benefits for customers as well. Another thing that we'll be rolling out here probably within the month is the ability for passengers to actually use that smart card at local vendors throughout the town via their electronic payment machines, say a credit card machine. They'll actually be able to swipe those cards and opt to reload there as utilizing cash as well, so opening up some possibilities. And once that system is in place, we'll obviously have more news to roll out to the customers. cars. But overall, we've gotten some pretty good feedback from the public as a whole. Passengers are now actually able to call in over the phone, purchase these cards. We're mailing them out to people pretty much daily. And we've got multiple schools already set up as vendors on this as well. So uptake's been going quite well. As of today, when I checked, we had over 1,300 accounts already set up on the system. So it's proven to be pretty popular.
That's great. Congratulations. We hope that really drives up usage numbers, since that'll add to the revenue. We've got a lot of fixed costs, but it's all about bringing up the revenue. So thanks. Other questions? Councilmember Purington?
So Rusty, how does the Met Transit, how do they advertise? I can't remember now the percentage that use the bus as far as, for transportation in Billings. But how do you advertise that? I think that doing some of these upgrades that you're doing, I think it's great. I don't know if more people would use it, knowing, that they've got these options for paying and they're riding.
As far as the word out to the public, we currently have a Twitter feed. We do Facebook posts quite regularly. We do advertising on the radio every month as well. And actually on this electronic fare system, we just did a piece with Color 8, I believe it was last week. They did a small story for us on the 5 o'clock and 10 o'clock news as well. So when we when we do these upgrades, we do our best to get it out to the community. It's just sometimes we get out there and people notice it, and sometimes it gets lost in the fray of everything else that's going on. But we do definitely push notices out to the community on a regular basis.
Thank you, Rusty. For those of us who have social media accounts, what would you recommend we share, or could you send us something that we could share?
Yeah, I can actually definitely, to the council as a group, I can send you the links to our Facebook pages and our Twitter pages. We're posting updates, like I said, quite regularly there. We do post updates for our passengers as well regarding service interruptions or any detours that are going up. So it is a pretty active feed. I've got all the supervisors here and my administrative staff that work on that quite regularly.
Great. Please send it, and we'll do what we can to get the word out. Thank you very much. Other questions for Scott, staff, Councilmember Neese?
Thank you, Mayor. Scott, the Montana, I think if I'm understanding correctly, you had the bridge, the downtown 27th Street Bridge Railroad Crossing study or something that you're talking here, but I didn't see in here something the council member Yakowicz brought up last week, or during that discussion about the 21st Street underpass. Is that anywhere in the scope or on the radar to look at this, or can that be included in this? Because as I looked at it, I think that's a really good alternative. I think I asked Debbie Melling if there's ever been any studies on that. I haven't heard back yet, but do you know of any studies that have looked at that underpass to see what could be designed and built there?
To answer your first question, no. The 21st, there's nothing in this TIP that we're using federal funds for that are going to that 21st Street underpass in any way, shape, or form right now. Now, future planning of that underpass. The simple answer is we might be able to use some federal monies to look at that underpass. Right now, the 21st Street is not considered on our system, so it's not eligible for any federal highway funding. We can always request that 21st or that underpass area be put on system, which will allow it to be eligible for federal funding. That's certainly an option that we could look at moving forward.
Mayor, if you don't mind a quick follow-up then?
Please.
So how would we go about getting that on there? Is that something the council has to request as initiative to be done, or is that something that, because I assume that being right along connected to Montana Avenue, the state, that roadway is connected or controlled by the state.
Correct.
How can we get that added on there?
Well, I think, it may start with a request of the council to our technical advisory committee, and then we can run it through the process and see sort of test the waters locally with the planning board and the commissioners, as well as MDT, to see how that kind of settles out. And we could certainly start the ball rolling on either an initial study or maybe some actual funding to see what we might be able to do there.
Okay, thank you.
Hey, Scott, on those two underpasses, there's NBA players that would have to duck their head to get underneath. Is it 13th or is it 21st or both?
21st, yeah.
Okay. And I live in fear of a big truck taking out one of those. I know we've lost the top of some campers. Could we at least put some sort of a warning bar back a couple hundred feet? If McDonald can do that, so that you hit it and it shakes on something on chains, is that doable?
I'm sure it's doable. That might be in another division other than planning, but I think it's probably doable.
Okay, well, maybe we can hire McDonald's. They got to figure it out. Other questions, though, for staff? I saw some other hands. Councilmember Joy?
Thank you, Mayor and Council. I just wanted to ask Mr. Walker, has Council ever removed any project from a TIP? And the reason why I ask that is, as we look at our cost of services, I look through the different projects in this, and a lot of them are infrastructure that's around the edge of the city. And as we move forward, how would this document reflect a deeper commitment to investment in the core of the city as the donut hole starts getting bigger and bigger? And as it is getting bigger, how would this document reflect the need for the city to really put that investment deeper into its core, into that center that's hollowed out? Thank you.
Yeah, to answer your first question, no. There's never been any project literally taken out of the program. And, this is the TIPs, it's a local document. It's our document as a community. We can add and subtract things as they become priorities in our community. And it can be a very fluid document. The reason, I guess, in the most recent past, it hasn't been that fluid is because a lot of our money that flows, federal money that flows through our community, and most particular in this document, has been going toward the bypass project. And that's taken us 5+ years to sort of fund with our local share of federal money. Now, having said that, as we get the bypass paid off, there will probably be other options to look at how we can spend some of our urban funds and some of our air quality money that are more specific, to our MPO area. And that becomes a conversation that usually starts at our technical advisory committee, but you as city council can certainly chime in at any time along the process.
Thank you. Councilmember Yakovich.
Thank you, Honored Council. Well, Scott, if we need to, I'd like to entertain a motion then to put 21st Street on.
I'll second that.
Okay, so the motion was to direct staff to at least start the process, whatever that looks like, to potentially, I guess, add 21st underpass to the state system that would potentially allow for federal funding. There was a motion by Councilmember Yakovich. There was a second by various people, including Councilmember Ewald. So we'll consider that a motion made and seconded. Chris Kapolsky. And Chris, we lost you earlier. So if you wanted to go back to what you were going to say on the last item, feel free to do that as well.
I'll be brief. Thank you, Mayor. I did want to let the group know we did have a conference call today with David Turch and Associate Staff Member Alexander Perez. If you don't remember, Mr. Turch, David Turch and Associates is who we're working with on federal grants out of the DC office. And what I wanted to communicate is they said it was not at all a surprise to them that we're still working through and haven't received that document yet from the Fed. So nothing that the staff is doing is causing that to slow down. It's just a reality of the process. It's like everybody's frozen on my screen, so I don't know if anybody's hearing anything I'm saying.
If you can hear us, we can hear you.
Okay, good. Then I'm going to turn it over to Debbie and Wyeth, because I think, Debbie, I'd like her to weigh in on this question about 21st. There are typically always some pros and cons to being on a state list and what can happen. So Debbie, could you give a little bit of feedback in what you know about kind of benefits or problems that might be caused by getting on their list? Thanks.
Sure. Thank you, Mayor and Council. I did want to make sure that it's clear that this is only for federal funding. There is nothing stopping the city from using city funds to address 21st and to do a study for 21st. And we do not have a study to date. We've been going through all our old files over the last week to try to find one. So there's nothing saying that we can't use city funds on that. If we get on the urban route, there are rules. We are then we have to meet MDT's guidelines, their design standards, and it can change a project. So I think it's not that straightforward to just get on the state route. There are some pros and cons to it. With a really challenging project like that, where the grades are going to be so very difficult, I think we need to be very cautious about putting it on the state route.
Debbie, can you tell us a little more what the downside is? Is there a way to at least start the process to make that judgment with a little more information? And would that be okay as far as you're concerned?
Yes, certainly. And I was trying to get to Councilmember Neese's email this week. Like I said, we've been searching high and low to see if we could find any studies. The biggest issues we have are design standards. Transportation standards have grades associated with streets. As you know, there's 2 points on that street. You've got grades set. So we may need some variances. It's a lot harder to go through the state system to get those. That being said, we're more than happy to start through the process and see if we can come up with some pros and cons and put a little bit more meat on the bones of the whole concept. And I think that might help us decide.
Okay, thank you. Let's clarify the motion then. Councilmember Yakowicz, I put some words in your mouth when I restated the motion, that the motion was to just direct staff to start the process, not necessarily to do everything to move heaven and earth to get 21st on the state system. Was my phrasing consistent with your intent to just start the process, but not necessarily to pull the trigger, so to speak?
I'm comfortable with that, Your Honor. It's just been a long time and nothing's been done. And I see a lot of potential there. And to spend 40 to 80 million on 27th Street when we can do a lot less on this one, I just want to ensure that it's not just shelved after this conversation. Okay, thank you. And Councilmember Ewald, that's consistent with your second? Yeah, okay. Okay, so that's the motion, and we do have a motion for discussion. Now let's look to our planning director, Wyeth. Would you like to comment? And then Councilmember Neese?
Yes, thanks, Mayor, and thanks, Mayor and Council. And just to follow up a little bit more on some of the discussion, both from what Scott and Debbie said, one thing, and we haven't had a chance, we are going to be visiting with MDT again here next week regarding the discussion and the feedback the council provided to MDT and the consultants regarding the railroad crossing study. And 21st Street was brought up as part of that discussion. And so I just want to mention that because we are going to be talking more with them about that in relation to the current 27th Street analysis they're doing. Not saying that that's the solution in itself, but there is going to be some more discussion on that because that was part of what was brought up by the council and the issue of rerouting traffic and looking at other options. So just wanted to mention that as part of as you're looking at this motion, just because I'm a little bit just concerned. Yeah, we want to make sure we can come back with some information, but there's several different things being looked at right now. So thanks.
Thank you very much. Councilmember Neese?
Thank you, Mayor. And I guess to clarify, I mean, if we did get it on this particular program, I think, Scott, you said we could, if you've never seen it come off, but we could come in off if we find out after the study certain design requirements are just going to be too stringent, and we as a city can maybe make exceptions and do it ourselves. Do I understand that correctly?
Yeah, I think that's correct.
Okay, and then just a quick follow-up, Mayor. If we do put it on this list, then we could get some federal funding. Not assured, but it's possible we could get some federal funding, maybe even for the study. I'm hoping. Maybe, Scott, you can address that. If that's a possibility, then we can at least find out with the federal dollars what we need to do.
Yeah, I think that's very possible.
Okay, thank you.
Thank you very much. Councilmember Chiriki?
While it's possible to pull it off of the TIF list, once we put it into the state system, is it possible to pull it out of the state system?
Yes, but if any money has already been spent, we're likely to lose that money or have to pay it back.
So it seems to me at this point, Councilmember Yakowicz and Mr. Mayor, that the best thing for us to do at this point is to encourage staff to continue doing what they're doing right now to start to figure out how to deal with this and not force it onto the TIF project, which the TIF list until we actually know a lot more. And that's how I will vote.
And that's my understanding of the motion. It is not to do anything to definitive, but just start the planning process or the investigation process, we'll call it. Any other questions, discussion? Councilmember Shaw.
Thank you. Yes, it is to just start the process, but the end goal of this process is to get this project on the state list. That's I'm understanding that correctly, Councilmember Yakowicz? That's the goal of the motion, right?
Well, yes. If we can get city funding to put it on, that's fine as well. But my goal is that we do this study as much as we can to get this rolling, and yeah, we can do initiative when Scott comes back to us and put it onto the state if we need to. But I'm very happy now that Debbie and Scott is willing to move forward with this.
Thank you. I am too, Your Honor, if I can just comment real quick. So I am too also very happy. And I just want to say, I do support a study for 21st Street. I think that's a great idea. I think we should do that. I am very nervous though about launching into this process when I feel like, and what I heard from the city staff was we don't have enough information yet to quite make that decision. I feel very nervous about putting this on the radar of the state, knowing what we have to go through to deal with all the state projects. I mean, it's great, yes, potentially access to more money, but that makes me quite nervous. So I just wanted to say, I'm not going to support the motion, but I do very much support pursuing 21st Street as an option. And I'm excited to hear and glad to hear that staff is already working on that. Thank you.
Okay, thank you. I'll just say it's my interpretation of what we're doing, that we're just asking staff to think about it and come back with some better idea of what next steps might be. And it's pretty limited scope in my mind, but that's just me talking. Councilmember Ewell.
Thank you, Mayor. I think what Mike is thinking about and what I was thinking about when I seconded it is it's kind of on the back burner, and we would like it to be moved to a front burner for city staff and see what the feasibility is. If it's not feasible, we don't do it. If there is some chance, then we can proceed further. But unless you do a serious look at it and not leave it on the back burner, you won't get anything done. It's hard to believe there hasn't been a study done in X amount of years, and that underpass has been there for I don't know how long, but a long time, I'll bet.
Thank you. Further discussion, Councilmember Neeson-Chiriki.
Thank you, Mayor. And I believe I have the same understanding as you, Mayor, is that this is really to move it forward. And I think the staff will come back to us and say, hey, we're going to do our own study, or we're going to put it on the state site and they're going to let them do the study. So that's the way I interpret that. So yes, I will support this motion because I think it's an important project. Like I said, I have looked at it and I think there's some possibilities there. I know it's only 8 feet now, but there's other ways that you can make that taller. And So we'll see if we can see what the study says. So thank you.
Thank you, Councilmember Tricky.
Staff has already indicated that they're moving in this direction. The thing that's making me nervous is that I haven't actually seen the actual language of this motion, and I don't know exactly how hard this motion, the language of this motion is going to ask us to push staff to put us on the state list to look for state or federal funding. So that's my nervousness here. If it's a very simple motion that's basically to say, hey, staff, take a look at trying to get a study done on 21st Street, I'm great with that. If it's a motion that says we need to do this in order to get state and federal funding, then I am not good with that. Honestly, I don't even know if state or federal laws would allow us to have an 8-foot underpass, which could really drive up the cost of this thing. So very general and light. Yeah, I think that's great. I think anything else is kind of pushing it a little too far at this point. We don't know enough.
Okay, Councilmember Purington.
Just to weigh in here a bit, I agree that I think it sounds like it's a very general direction. In fact, as I was looking at what's coming down the pike on our agenda, even here, we're looking at priorities. And one of the priorities that was listed was infrastructure, transportation infrastructure. So I think it's just something that we're asking staff to look at. Debbie's already said she doesn't know that state funding would be the way to go. So I don't think funding is an issue at this point. I think it's the feasibility of even doing it. And then you start looking at funding. So right now, I think it looks like it's an engineering question, and I would be more than happy to support that for them just to continue what they've been doing. Thank you.
Okay, any other comments? Okay, I guess we'll move ahead to a vote on the motion. Again, there's been, okay, Councilmember Ewald.
Do we need public comment on this?
Oh, yeah, absolutely. Thank you, Councilmember Ewald. We do, and or at least on this topic. And so let's get that before we take any sort of definitive vote. Thank you. The phone number 237-6196. Please call that number now if you'd like to comment on item number 4. That's the draft transportation improvement plan with those amendments. Even though a lot of the focus here has been on this 21st Street underpass, it's a lot broader than that. So feel free to comment on anything related to it. Please keep your comments to less than 3 minutes. Tell us your name and address, and please turn off or mute your screen and just listen to the telephone and the person on the other end. The number again, 237-6196. We'll give just a brief delay. Denise, please let us know if you have anybody call 237-6196.
No callers, Mayor.
Okay, we'll proceed to a vote. Because there has been some debate or questioning about the scope of this, the motion itself, I'll do my best to restate it. Councilmember Ewald and Councilmember Yakowicz, it was your motion, so please correct me. But the motion, as I understand it, is to direct staff to investigate the situation with the 21st Street underpass and to come back to council with some sort of recommendation of what staff would see as possible options to continue or abandon the investigation process for the redevelopment or other actions involving 21st Street underpass to help solve the problem to get people back and forth underneath the tracks. But that's it. just directing staff to look into it and come back, report with what options might be, including this question of adding that or not adding that to the state highway system. Councilmember Yakowicz, Ewalt, thumbs up, thumbs up. Okay, so that's the motion. Please don't ask me to restate that again because I didn't write all that down. All in favor of the motion, please raise your hand. Voting in favor are all members of the City Council. The motion passes unanimously. Thank you very much. Is there anything else related to item number 4, Scott, before we move to item number 5? Don't see anything.
No, Mayor.
Okay, so thank you very much, Council. We'll move to item number 5, the Downtown Billings Traffic Study. Again, it's traffic night. This is the public survey and investigation process on all of the two-ways to one-ways and the Broadway closure and possible bike lanes, things like that. So, Scott, tell us about it.
Yeah, thank you, Mayor. I would like to introduce Lisa Olmstead and Doug Anderson from Dow. They are assisting us with sort of the public participation piece, looking at sort of the retooling of our downtown. As you remember, a year or so ago, Public Works did some work, and they looked at what could be feasible insofar as changing the look and feel of our downtown by doing several things, like changing two or one-way streets back into two-way, putting some streets like Montana Avenue on a road diet down to 2 lanes, and that sort of thing. Basically, and I think we'll go into a little bit of this, but basically there were 6 or 7 ideas that came out of that study that our Public Works Department felt that we could move forward with, that would be actually feasible to do at some point. So our job was to put together sort of the public participation piece of this, and quite honestly, this might have been done several months ago had it not been for our COVID situation. Again, it's tough pulling together public participation when you can't really get together and meet. However, Lisa and Doug did a great job at talking with people around our community and getting a real good cross-section of discussion going. And with that, I can turn it over to Lisa. I think she's going to move this forward.
Thank you, Scott. Thank you, Council, for having us. I'm going to share my screen. All right. So yeah, thank you, Scott, for the introduction. That was great. As Scott mentioned, this was based on the downtown traffic study. This particular effort was called the Alternative Prioritization and Public Preference Plan. And as Scott alluded to, this is the cover of the study that was released in June of 2019, was commissioned by the engineering division of the city, was conducted by Kittleson and Associates with support by Dowell. So the study itself dove into all of the technical flow, the traffic patterns, how downtown functioned, and resulted in 6 feasible alternatives. And so the scope of this effort that we are just wrapping up was to collect the public participation on that. So that was the entire scope. So it is very easy to get into the why and how and, why did you pick these things? But that was not necessarily the scope of this particular project. We were basing it off of the traffic study. But in order to have a really engaging dialogue with the public as we were out on the streets, our approach was to have me always teamed with a transportation engineer in order to have conversations with people to discuss the advantages and disadvantages of all of the alternatives. So that's me, Lisa. Doug is with me here, and Ryan Guelph is another transportation engineer. he just got his PE. Good for him. I need to update this slide. But so we were always teamed to go out to the public in order to collect as much very relevant feedback as we possibly could. So just as a quick review and reminder, the project area is indicated here on the map. The gray dotted line is the boundaries. The one-way to two-way conversions are indicated in green, light green for north and south, and the dark green for east and west. And then road diets are indicated with dotted lines. Montana Avenue, North 13th Street, and 6th Avenue North right here. And then we did also ask the public about their perspectives on a seasonal closure of Broadway. And Scott talked a little bit about our scheduled challenges. We were awarded the project and given notice to proceed last winter, early 2020, and we got all of our plans in place. And then I think, like everyone, all of our plans kind of got halted, and so we paused for a moment. We reworked our outreach plan and wound up hitting the streets in summer and fall with outreach. And then in the winter of 2020, we compiled all of the data. And now here we are in winter of 2021 presenting it. Just a little snippet of some of the media and the outreach that we did. One could make an argument that because of COVID, we did stall for a moment, and I think there was starting to be a bit of COVID fatigue by the time we hit the streets. So we did get very good media coverage and generally pretty good support with many of the stakeholder groups. But fundamentally, the biggest piece of the outreach was a website, and that gave us the opportunity to collect all of the feedback in one singular, consistent location. So the website did have frequently asked questions. We gave photos and, defined all of the terms. What is a road diet? What is a sharrow? What is a mixed use path? All of those kind of terms. And then there were 3 opportunities for public participation. The one that we really focused on, and kind of that, if nothing else, fill out this survey. In addition to that, we also had a budgetary feedback tool available to the public, and then an idea wall, which was basically that bulletin board for people to add any comments that they felt weren't encapsulated with the other pieces. So general takeaways, the feedback we received was generally receptive to the alterations to the current traffic system. We received very passionate and thoughtful opinions, which we were really happy by. Citizens are engaged in the community and very much in downtown. They are hopeful that improvements would increase economic vitality and spur development. Meanwhile, they are concerned about accessibility, walkability, and bikeability. So the results on the survey, the website itself received over 6,000 visits. That represented almost 2,400 unique users. For a sample size, for the size of Billings, we needed 383 survey participants. We got 455. On the comment wall, we received 526 comments, and 34 people went to the full extent of even completing the budgetary piece of it. So just a general overview, and I will kind of slide through a lot of these graphics quickly in respect for your time, but all of these graphics are also included in the study draft. But age range and gender are indicated here. We asked about level of education and annual household income to get a good feel for who we were talking to. We did also ask about their zip code, both where they live and where they work, in order to get a feel for what their commute looks like. That's hard to illustrate visually, but the point is that we have a lot of data that we collected, and you can really dive into it very deep if you wanted to know what do people in this particular age bracket think of this particular alteration or whatever. There's many different ways to analyze and extrapolate information from the data. So I'm going to give you, go through it question by question, but I will go through fairly quickly. And like I said, I'd be happy to answer questions, and all of these graphics are also included in the draft survey. So what each of these slides will look like is what is actually feasible is different street to street. So the questions were very specific and very targeted in order to actually ask people about implementable, actionable facilities. So in this case, we're looking at 33rd, 34th, and 35th. And the two green colors are both, yes, I would like to convert from one-way to two-way. And then amongst the yeses, there are a couple different options. One where the conversion includes only parallel parking, and one where the conversion includes front-in, angled, and parallel parking. And so because of the way the question is asked, we stacked the yeses because it is, it's this many people that are in favor of a conversion. And then the people are, broken down based on the specifics of that yes vote. So all of the questions do also include a no build, like nope, leave it exactly the way it is. So those are always indicated in this rust color here. So this is 31st, 29th, and 26th. Of the yes votes, those are broken down between back-in angled and parallel parking and front-in angled and parallel parking. We definitely did have some very engaged conversations about the idea of back-in parking. It's a little overwhelming to the public, but there is, there are some people that are open to it when we discuss the safety benefits. On 30th and 32nd, the yes votes were broken between angled parking with a sharrow or a protected bike lane. And of course, as always, a no build option. On 25th, the yes votes are broken between front-in angled with a sharrow or parallel parking with a protected bike lane. And this is the one block right there by the Met transfer station where the needs are different and unique to that particular block. So in that case, the yes votes are broken between a sharrow in each lane with no on-street parking, or a conventional bike lane and sharrow. And again, no on-street parking. And then as part of this, we also developed some visualizations to help, as the jumping off point for the next stage. And this one is actually has a disclaimer on it in the study because our outreach project was happening simultaneous to some bonding that was triggered by some TIF funding. So this particular street is actually already in process and has been designed, and the engineering department did some stakeholder outreach and coordination with the immediate property owners. And so this street will be converted. This is 30th. So I'm talking about 39th and 20th, or 29th and 30th. And it will be converted from one-way to two-way, but it will not include a bike lane. So this visualization isn't accurate because the two efforts were happening simultaneous. But we've made a note of that in the study. So now converting to the east and westbound, both streets were addressed in one question, but there were 3 yes answers. One was a center turn lane with sharrow. One was a two-way travel with sharrow and front-in, angled and parallel parking. Two-way parking with conventional bike lanes and parallel parking. So you can see again, the yeses outnumbered the nos, but the specifics on how the details would look are broken between those 3 options. And here's a visualization for that. And for context, this is the A&E building, the former Y or Wendy's. And then on Montana Avenue, we asked the questions, and we'll be looking at them in the order that you travel down Montana, going one way. So in this case, we were looking at a road diet. And so, of course, always no, leave it the way it is. Or, yes, I like the idea of a road diet, and I would like it to be a cycle track. And as a result, no on-street parking will be available, or separated bike lane with back-in angled parking. And then between 27th and 30th Street, the options for a conversion included a cycle track or a separated bike lane. And the third section of Montana Avenue from 18th to 27th, the yes conversion choices included back-in angled and parallel parking with no bike facility, a cycle track, or a separated bike lane. And here's a visualization of what that might look like. So you can see McCormick Cafe is right there. The depot is right over here. And then again, a road diet on 6th Avenue North. And here we are flipping directions because the one-way street goes the opposite direction. So in this case, we're looking at 10th Street to Main Street. And here the choices were a multi-use path with the road diet or a protected bike lane. And similarly, here the choices were a separated multi-use path or protected bike lane. And there's a visualization of what that might look like. And North 13th Street, again, a road diet conversion. The yeses were broken between a Sharrow with center turn lane and parking or conventional bike lane and parallel parking. And then on the southern end of 13th Street, there was only one option that was feasible, and that would be a protected bike lane. And there is a visualization for that. And finally, the last question was about the prospect of a seasonal closure of Broadway Avenue. So you can see the yes votes versus the no build, leave it the way it is votes. And there's a visualization. So now what? We did also ask the public to provide feedback based on what's the most important. So they say yes all across the board. What really matters? Where do you put your money first? And so this question asked people to rank them. So in this case, the rank number 1 is at the bottom in green, and then they go up from there. So the north and south one-way to two-way conversion and the Broadway Avenue were the highest. They're the most popular, followed by the east and west one-way to two-way, Montana Avenue, 6th Avenue, and finally the 13th Street. So you can also see that participation started waning as people got less excited about the particular alternatives. And that is the end of my presentation, but I certainly would open questions. And like I said, my colleague Doug is here too to answer any questions that dip into the more technical realm.
Thank you, Lisa. Excellent presentation and slide deck there and survey. Could you, I just made a list of 3 quick things, if you could clarify about your presentation before we
Certainly.
get into too deep. One, you used the word survey and talked about 400 and some responses. Obviously, that was not a response to the website. So what was the survey versus the website input? That's one thing. Could you, I'll just give these to you all, and you can do them all at once.
Sure.
The difference between a cycle track and a separated bike lane, if you can explain that. And lastly, on the Broadway closure, the picture in the presentation had 2 travel lanes and then seating areas off to the side. It was not an actual closure of the road. My understanding was that the contemplation was an actual closure of the whole road. So if you can clarify that. So anyway, survey, cycle track, Broadway.
Okay, I'm going to start with number 1, and then I'm going to jump forward to number 3, and then I'm going to kick the ball to Doug for number 2. Okay?
Okay.
All right. So the first question was a survey. You are absolutely correct, and thank you for bringing that up. The website did collect information. When I used the term survey, I was referencing the physical survey function embedded in the website. there were those three different participation options. One was an actual survey where you click it, you bring it up. It's very, very much like a Survey Monkey, where you click the radio buttons, or you prioritize, or there's an empty text box where you can provide feedback. That is the survey itself. So one of three participation options. Moving forward to your question number 3, the traffic study did actually ask about a full closure of Broadway. And in planning, our colleagues over at the MPO suggested that we actually modify the question specific to this one and to discuss the seasonal closure, because that might be a little bit more implementable. And so the visualization is reflective of a seasonal closure, where it would be some kind of modular pop-up bollards or something like that.
Okay, but that still allows cars to go through?
Seasonally, but I'm going to share my
screen. How about during the summer? I mean, wouldn't it be a complete closure in the summer?
I think that would depend on the logistics and what the city decided to do. But there are various functions. You can bring them up and leave them up for the season, or you can, pop them up for 4 hours and take them back down too. So the questioning was pretty vague and just more of like, do you like the idea of potentially a seasonal closure? We didn't actually even say what season we were talking about technically. So whether it would be summertime or fall or whatever, it's just the okay. Very broad concept.
Okay, thank you. And Doug, on cycle track versus separated bike lane or bike. Yeah.
You bet. Good question, Mr. Mayor. The difference between a cycle track and a separated bike lane, the way we presented it, and I guess I'll qualify all that by saying when we had this presentation and talked to a lot of the members of the public, we clarified a lot of these terms, just because it is something that it's very unique to our industry. We want to make sure that everybody understood what they were, voting on. But a cycle track essentially is a separated bike lane. I know I'm using some interchangeable words here, but usually with two-way bike traffic. Whereas a separated bike lane would generally be in a one-way direction, usually with the same direction of vehicular travel. So that's fundamentally the difference between the two in the context that we use throughout the report.
Okay, thank you. Other questions? Councilmember Purinton and Councilmember Tricky.
Thank you. So Lisa, going back to the survey, the public engagement, I couldn't read all the numbers fast enough.
Oh, sure.
But so whenever you said, I think that you only needed something like 355.
383.
Okay, but then you got over 400. What is that based on? Is it based on population of the downtown area or the population of Billings?
Yes, that's a very good question. That's the population of Billings. And I reached out to some people that know more about statistics than I do, and I asked them what it would take to be a statistically valid survey. And so I Googled what the population of Billings was. And at this point, I believe we were basing it off of the 2018 census. Is that right? But yeah, that is where those numbers came from.
And then what is that percentage then? Or is it based on a percentage?
It is based on a percentage, and I don't know that off the top of my head, but that content I can certainly give you more on in a follow-up email.
Okay, and then follow-up, Mr. Mayor?
Please.
In doing this survey, there was absolutely no indication as to how much any of this would cost or where those funds would come from.
We did, in all of the outreach, include the construction costs, the estimated construction costs, which were included in the traffic study. But no, we did not talk about where the funds would come from.
Okay, thank you.
Councilmember Tricky?
I'm wondering, so you were talking about the back end versus front end parking, and I thought you kind of allude to having conversations with people. And I'm guessing that a lot of the resistance was lack of familiarity.
Yes, you're absolutely right. We did talk about it with people. Some people were familiar with the scenarios in Billings where it is present, in the eBird and over by McKinley, for example. Others had no idea, and it was a completely foreign concept. So
some people were talked into it?
When we talked about the safety and the back and forth, it's hard to say because when we were having conversations, I don't know what they were actually clicking on the survey. So I wouldn't say that people were talked into it per se, but it seemed as though people were open to consideration.
Thank you.
Great. Other questions for Lisa, Doug, or staff? Councilmember Neese?
Thank you, Mayor. Lisa, on the, I was just looking at the data as far as you selected, the gender, age, things like that, where their zip code were. Did you do any other demographic questions? For instance, like if they commute regularly with their bike, or they commute regularly with their day or their home, work from home, what their recreational activities were? Did you get any kind of sense of what the people who answered the surveys, what their activities were?
That's a good question, council member. We did ask as kind of supplementary questions whether they use bike lanes, kind of a never, infrequently, often. And we also, as an add-on question, we also asked about whether they ever use parking garages. So in addition, we also asked about race. So there were a few other questions. I kind of picked some of the highlights for the purpose of this presentation, but that information is all included in the full draft report.
And do you recall what the respondents were for those who use bike lanes?
Kind of 50-50 when it is broken down into, the use frequently or, kind of frequently versus never touch them. Okay. And then Mayor, another quick follow-up on that then. Please. So going back to Councilwoman Puritan's question about the statistical validity, I understand it's over that limit, which does make sense, but I'm wondering if how it is if we have a particular group of people answering the question that are maybe heavily weighted towards one activity or another. For instance, if we had 50% of these were no, I never use a bike path or never ride a bike, we may see different results. Would that statistic that you collected about the usability of bike lanes and that have indication on the validity of the response? It's a good question. We did actually have one other question when we were presenting it once before on how the demographics aligned with the 2020 census. Mm-hmm. And those demographics do align fairly closely, with the exception of children. There are no children, of course, that would be, participating in this. So there is, I think the survey generally does align with the general population. Okay. So and actually,
50% of the population typically will use the bike path one way or another.
Yeah, and I'm looking for the data on the bike path specifically, and I can tell you that in just a moment.
Maybe I'll fill the silence here while Lisa looks for that. One thing that Lisa didn't share at the beginning of her presentation was we focus on trying to get out to the entire community, not just focus on downtown residents or downtown businesses. The study itself was focused in that downtown study area, as you saw, but there's a lot of folks on the call today that we are out to your respective ends of town with task forces, meetings, and various service organizations also to solicit input. Realizing that our downtown is a fixture of our community, but various uses of our downtown, we want to make sure to capture that.
Okay. Thank you very much, Councilmember Ewald.
Whoops.
And here is the chart illustrating the how often do you use bike lanes question.
Great, thank you. Appreciate that.
Certainly, I'll stop sharing now so you all can see each other.
Thank you, Mayor. Okay, so when you were talking about on the website, it looked like you had 6,176 hits. Is that true?
Let me pull that up so I can.
And that's, no, you don't have to pull it up. I wrote it down as you had it.
Okay, yes, that is correct.
Okay, and so you had 455 responses out of that. Is that true?
To the survey specifically. On the website, there were the 3 different participation pieces. So the 455 was for piece number 1, the survey. There were 34 participants for the budget response, and then there were 526 comments on the idea wall.
Okay, so for the survey, that's what we're looking at now. So that figures up to about 7.3% response out of that. And then you needed 383. That comes up to 0.3% of the population of Billings. So it's really not too much, but on those questions, when you had yes, yes, and no on most of them, if you would have put a dollar amount on what this is going to cost for each section, yes, I'd like all kinds of stuff, but can I afford it? No, I can't. So no. But that's the way all these surveys are built, to get yeses so that you can come and present a big yes picture, and then we got to come up with a way to come up with the dollar picture. And that's the tough part. So I think it would be a lot more beneficial if you would actually incorporate a dollar amount with the question when you ask it, so people know how much it's going to cost them.
We did. It wasn't on the.
Was it listed with the yes, yes, no answers?
It was included in the presentations that we did, and then we did an interpretive video when we were changing our approach to be COVID friendly. We did a video that included all of that with the interpretation. So,
follow up, Mayor, please. So you did that there. I understand that, but on the actual survey where they had to check blank, blank, or blank, there was no monetary figure listed when they actually checked yes, yes, no, right?
That's correct.
That's what I figured. Thank you.
Thank you very much. Other questions for staff? Lisa, Doug? I have a question. It's probably going to be more our city staff, but if Doug in particular has an answer, please chime in. Looking at a lot of the comments, there was the opposition comments were concerned about increasing congestion on these roads if we put any of the roads on a diet or go to two-ways, which typically may not move traffic as fast or in high volume. How do we measure congestion? I understand congestion at an intersection. We have a very well-established A through E, I guess, scale for wait times at an intersection. But what streets are officially congested in this study group, if any? And if so, how do you measure that, and for what period of time? And I'm just not sure what to make of that word.
Yeah, that's a good question, Mr. Mayor. The congestion is a word that we use kind of as a layman's term about traffic, but truthfully, when we study it, we look at delay. And that is, how long you spend in the system, whether you're stopped at a stoplight or if you're going really slow, because of side friction, like parking, on-street parking or number of approaches or driveways through a corridor. So this study looked at that. The initial traffic study that was done by, that was sponsored by the engineering division. That was the biggest concerns. I mean, the history is, city engineering and public works were getting lots of questions about the what ifs, and there was a lot of answers given on, kind of what they thought would happen if there was conversions happen, or if we, converted, added bike lanes, for example, or something like that, and never really a true study of the, the downtown corridor area. And that's why that's where the thought of sponsoring a project that actually studied all of that. And so with with that traffic study, what was looked at was that congestion or that delay through downtown with these various alternatives that just been asked over the years. So we did we counted a bunch of cars at all these intersections and all these segments. We did travel time, what we call travel time studies, where we calibrated our model to make sure that what you were experiencing today driving through the corridor was actually being predicted in our model. And then we looked at historical growth data of Billings and in particular the downtown area and applied that so we could look as far as we could in the future. 2040 was our design year, given historic growth rates, and applied that to our current infrastructure. And, so looking at the no build, what if we do nothing? What if we did some of the conversions of one way to two way and the north south and the east west and, did some road diets in a handful of areas? What would that do to that delay, that congestion throughout? And it's purely just a qualitative analysis, like you said, that gives you an A, B, C, D, E, or F score. And that's what was reported on in that group. Now, we as the folks that have completed that traffic study didn't necessarily say what was acceptable or not. That's something that, the engineering division essentially would weigh in on. And other officials in the community. But, we just want, we would use our expertise to supply what that would look like. And that's evident all over through that traffic study that was done prior to this project that we had completed to take, to the public to get public feedback.
Okay, thank you, Doug. So that data is in the underlying traffic study. And before making any final decisions on any of this, obviously one would want to look to see what the impacts would be on travel speed and quote congestion. The ABC study or a standard then is also a travel delay, or is that just for the intersections, or this is actually between intersections as well?
Correct. So yeah, you bring up another good point there. And of course, this is getting really into the weeds for technical, but you can do level of service analysis on roadway segments as well. But with the tight knit network we have downtown, it makes more sense to analyze the intersections. And if intersections start breaking down as far as not being able to process all the traffic, then that's what would trigger us to do make more of a segment analysis to see what the capacity issues are, if we need to add lanes or reduce lanes, things like that. So we didn't do a specific segment analysis, which is something, traffic engineers do, but it wasn't necessary for our downtown corridors. Focusing on the intersections and their ability to process traffic given the configuration was adequate to understand how well our network would respond to changes in the traffic patterns.
Okay, thank you very much. Debbie, is there anything you want to add to that?
Thank you, Mayor and Council. If I could, I will send out that traffic study to all of you so that you have the link to that. One of the things that we looked at in that traffic study is adding turn lanes at the intersection. That's a lot of the trade-off you saw in that study we did. You lose so much parking, but it keeps the congestion down. So those are the trade-offs we actually analyzed in that. I'll send you all a link tomorrow or tonight.
Okay, thank you. Other questions for staff or Lisa or Doug? Councilmember Trickey and Councilmember Joy.
I know it's impossible or very difficult anyway to predict the future. How do you take into effect changing patterns of how people want to use transportation when you look at something like this?
That's a great question. Part of it starts with what's available. We also use travel demand models, and recently City County Planning had a project that incorporated the travel demand for the entire street network in town. That does, I don't recall if that took in the transit and took in the mode share for bikes and pedestrians, just walking to and from work, things like that. The growth rate also reflects those trends over time. Maybe the desire to live and work downtown that would lessen the number of trips to and from a downtown area. So those kind of things all get averaged out typically in that manner, unless there's a major change. For example, a pandemic that may affect traffic patterns. Most of that stuff you can see throughout the data and the growth rates over time, what's influencing that.
Thank you, Councilmember Joy. Councilmember Neese?
Thank you, Mayor and Council. Thank you for this really great presentation and the data. I also wanted to suggest that including active transportation also means that we as a community receive a dividend, in the sense that we have healthier people, we remove some of the pollution and the congestion that we have. So active transportation outweighs its offsets, and in a sense its downside by removing some parking. So I really do appreciate the presentation that you made. I wanted to ask one question. I read through the comments, and there were comments about parking, quite a few of them. I just happened to be downtown today, and I could have parked anywhere. Absolutely no cars parked downtown today. So the quality or the actual comments, they were part of the survey process or a part of just what was available on the website. So I just kind of wanted to tease that out. Thank you.
I'm not sure I quite understand your question. The comments there was opportunities for comments both within the survey, if you had a comment specifically to, say, the seasonal closure on Broadway. And then there was also the ideal wall where people could put any comments that they felt weren't encapsulated elsewhere. So those are broken apart and are identified in the report.
Thank you.
Thank you very much. Councilmember Neese?
Thank you, Mayor. I've been to a couple of cities that have some of these type of roadways, and they're a little confusing. You got to watch out to where you drive so you don't hit a curb or something, but I can see how they definitely separate you away from the pedestrian bike traffic. This is actually to Debbie's comment she made about the traffic studies going to be sent to us. Debbie, are traffic studies including non-motorized vehicles traffic now as well?
It depends on the scope of the traffic study, but yes, we can analyze multimodal as well when we do them.
Okay, is that something you normally do? You say it can be. So is that something that you normally do for in certain areas like downtown where there may be more heavy traffic or corridors that we know that there may be? Is that something that we routinely do, or is that something that has to change so we routinely do that?
If we think that the multimodal transportation will be a factor in the analysis, then yes, we would include it. If we don't think it's going to be a factor, then we wouldn't. So a lot of times we add multimodal facilities, but it won't necessarily change the number of travel lanes or where we're going to put those facilities. So it really depends on what we're trying to accomplish. But yes, we consider multimodal in everything we do.
Okay, and Mayor, I guess just make a comment about that is we hear a lot about different ways to build roadways, and I can't necessarily disagree or agree with those, but we also don't see a lot of traffic studies that show a lot of pedestrians, or when we do, it's like a one day a year account. It's just not very accurate. So if we are doing more traffic studies, I would like to see the city maybe include more non-motorized vehicle counts when they do the traffic studies, so we can really have a good historical data on all the traffic. So thank you.
Thank you very much. We're past our time for a typical break, so I'd like to move to public comment quickly. Soon, 237-6196. Feel free to call that number now, but while we're waiting, Councilmember Purington?
Thank you. So just piggybacking on what Roy was talking about, Debbie, because I had this question earlier, and it is kind of coming up in this discussion. Our weather sometimes doesn't allow for people to either ride or walk year round. So whenever you do those the traffic studies, are those pertinent to our weather? And again, are they pertinent to whether or not it's actual commuter transportation issues versus recreational?
So most of the time when we do studies, we do them in the summer. We rarely do a traffic study. Well, I'm not going to say we rarely do a traffic study in the winter. We do traffic studies in the winter if we have weather that's appropriate. Right now, we can do traffic studies. We try to make sure that the traffic studies we do are indicative of the traffic that we see in the area most of the time. So does it include pedestrians? Sometimes. I mean, most of the time what we see pedestrians and bikes, that sort of thing, it doesn't change the vehicular traffic enough to change the results of the vehicular transportation study. So it's just not a big enough factor for the most part.
Okay, thank you. Denise, do we have any callers to 237-6196?
No, Mayor. I've had no calls.
We're going to continue to take some comments from the council members here. 237-6196, and we'll plug you in as we get a call. If we do, Councilmember Brown.
Thank you, Mayor. I'm looking at the your survey results and everything on page 29, and we've got the results from the survey, and then we've got what I'm thinking is results according to cost. So they almost flip completely around. Am I looking at that correctly or no?
You are looking at that correctly. The one thing to clarify, though, is that there was not huge participation in that budgetary piece of it. So that's why I kind of let that slide for this presentation. But yeah, you're right. The way we presented it was, if you've got, a number, we distilled the dollar values down dramatically and said, if you have $100, do you want to put all of it towards one big improvement, or do you actually like the idea of doing many smaller improvements? So that's the result of that.
Oh, okay. So those weren't estimated dollars that it would actually cost to do it.
It took the actual construction cost that was provided in the traffic study, and then we kind of allocated them, diminished them down so that they were actually kind of palatable numbers in order to make it public facing.
Okay. I just thought that was interesting, and boy, I better check and make sure I'm reading that right.
Yeah, you can see actually what people were asking for was kind of many little things as opposed to the one very expensive thing.
Yep. Okay, thank you.
Okay, thank you. We'll ask other council if they got questions, but Denise, do you have a caller?
I do, Mayor. I have Pam Ellis on the line from 2000 Outlook Drive. I'll put her on now. Hello, Miss Ellis, are you there?
I am.
Okay, we are ready for your public comment. You have 3 minutes.
Thank you, Denise. I just wanted to clarify a statement on statistical validity. So you can't just pick a number. 3/10 of the Billings citizens do not present a statistically valid sample. To develop a statistically valid sample, you have to select the participants, and they have to represent a breakdown that's representative of the city. So you have to have 32% that would come from the Heights. You have to have a breakdown male and female. You have to have a breakdown of those who transport. So there's no validity whatsoever statistically. You have a response. And I guess I have some other questions. When I look at the pictures for Montana Avenue and no parking in front of McCormick's, I already know that there are groups that I belong to who refuse to have group meetings at McCormick's because there's no place to park now. So I think there also has to be some indication about what's the impact on the businesses. And I don't hear any of that. I personally experience a lot of issues getting into and out of the Heights if I'm on 6th Avenue or 4th Avenue. I can't conceptualize, as the mayor said, putting 4th Avenue and 6th Avenue on a diet. I don't know how that would work. And I don't see anybody on bicycles anywhere that are actually on those really busy streets on a really consistent basis. There's a few, but certainly not enough to take away an entire lane. Thank you.
Okay, thank you.
Thank you. Any other either questions from or comments from the public or from council members before we close public comment and adjourn for a break?
Mayor, I have no other callers.
Okay, we'll close the public comment period on this item then, and I don't see any other hands. So, Council, it's 7:46. If we try to come back no later than 7:55, it'd be about 8 or 9 minutes. If we get back all before then great. Otherwise, see you no later than 7:55. Oh, I'm sorry.
Is everybody gone?
We might, if you're still with us, do we have another caller, Denise?
It looks like they just hung up. So
okay. All right.
They must have heard you close it.
Yeah. Okay. See you at 7:55.
I had asked, and I think Pam Ellis had mentioned about this, having a survey being statistically valid. That was my concern, is just the demographics needed. I want to be able to support these studies when they're out, and if they're not statistically valid, it makes it difficult to support. And so I guess the question is, when we do these RFPs or these studies, do we require them to be not just statistically valid in the general sense, but statistically valid to the demographics of Billings, Montana? Is that something that we require? And if we don't, should we consider that so that we know that we're actually getting some statistically valid surveys? Wyatt, do you know?
I'll weigh in first, if that's okay, Mayor, and then I'll appreciate Wyatt or Debbie. I think in a general sense, it just totally depends. You'll find when we get into the Palco Police National Citizen or Center for Public Safety Management, that was a very expensive study. And yes, it includes a very rigorous, statistically valid survey tool as a part of it. Other times we're trying to just simply get public feedback, like on Monday nights. There's nothing statistically valid who calls into City Hall or who stands in line when we get to do that again one day. So it really depends on what is happening and how much resources being allocated would be my general statement about them. So I couldn't say they always go this way or that way. Wyatt, if you want to give any other kind of more specific to planning, some of the transportation stuff that you're seeing?
Yeah, thanks, Chris and Mayor and Council. I think mainly, what Chris is saying is correct. I mean, we, in this case and in most of our transportation studies, we are looking at trying to get a representative sample in terms of the number of people that participate in the survey versus when you talk about, there's sort of, I guess, statistically valid, there's two different things going on. There's you get a sample of a certain number of people out of the entire community, wherever they are and whoever they are. And then there's a different type of survey where you're actually trying to purposefully get representation across your demographics, across your whole community. And so, like in some of the things we've had to do in the past in community development for some of the HUD programs, we're looking more at that aspect of it, whereas in these transportation studies and many other studies, it's a representative sample of a total number of people, not that you've hit all those demographics. So I would say that's how we've done them. And so yeah, it's two different things. And so no, we don't normally do that with these studies in this situation.
Okay, all right, thank you.
And I think we would all agree that if, at a minimum, whatever the process is, we would benefit from a description of what the process was, what the limitations might be, just so we understand it. Certainly, if you do not initiate contact and you just rely on groups to contact you, as Pam Ellis said, you can't rely on that because you can't control who it is that's contacting you, right? So some sort of discussion of that, I think, would be valuable. Anything else before we move on to our next item? I will comment on that. There was somebody who tried to call in at the last minute just as we were breaking. And we don't want you to call in now. We apologize. We did close the public comment. But if you'd like to send your comments by email to the whole council, you can do that by just contacting or going on the city's website. And this is for anybody. And send us an email. Please do. We welcome your input. Anything else? Okay, we'll move on then to item number 6, the city sidewalk program. More transportation. Our Public Works Director, Debbie Melling.
Thank you, Mayor and Council. Thank you, Councilmember Chiriki, for the initiative so that we could come and talk about these, about sidewalks and the programs that we have. So I will try to address everything that I think went into this initiative. If I missed something, happy to answer some questions at the end. So I'm going to pull up my screen here with the presentation. Okay, so I know it was about sidewalks, but oftentimes trails are so interconnected on how we do what we do. So I added trails here just because throughout this, sometimes the projects that we do have sidewalk and trail somewhat interchangeable. So I will refer to trails just a little bit in here. So right now we install them a few different ways. One is through our large capital projects. So anytime we have a road project, we install sidewalk. The Missing Sidewalk program, we'll talk about that in a minute, our annual pedestrian crossing program, and then several other ways, and I'll get into those in detail. So the first way that we install sidewalks is with our large projects every year. This is King Avenue East that was done this last summer. It's funded through several different sources. We have gas tax, arterial fees, property owner assessments on every project unless it's in a TIF district. Specifically, the South TIF has chosen not to do assessments on the large projects, and then TIF district funding. So those are the four main ways that we fund these large projects. If it is an arterial or collector, we tend to put the trail on one side, sidewalk on the other, assess for a portion of the trail. But we do get about a mile a year this way. And so it's a big part of our sidewalk program. I listed some examples here, but I'm sure you're all very familiar with most of them. Both King Avenues East and West, Central and Grand, Orchard, Calhoun, Aronson, Alkali Creek, Lake Elmo. Jackson Street sidewalks is an example where we just did a sidewalk project. It wasn't necessarily a street project, but it was a large sidewalk project. And then the eBird, we've had two different sections of the eBird area that we've done projects like this that have added sidewalks on both sides of every street in that area. The second program that we have is our Missing Sidewalk program. And I know you're all very familiar with that because we talked about it a lot last year. That program is one we put together every year, and we look at areas that are missing sidewalk. And we fund that through gas tax and property owner assessments. The visual here that I put is how we prioritize, or this is one tool we use in our prioritization. That program really is, eventually we hope to get through the whole city, but we have to prioritize recognizing we have a long ways to go. So we look at areas that have school routes, arterials and collectors, and anywhere that we see high pedestrian use. Every school in town has a map like this that shows how we want students to access the school through walking routes. So every one of those schools, we're working on a program where we're going to go back a half a mile and make sure that the sidewalks are completely filled in. We don't have that inventory yet. We have some of it, but not all of it. So I put it on here so you could see what we have as a starting point for some of the data that we're collecting. And then I put on here the installation schedule. Really, there's no limit to, well, there are a couple limits to what can be done here, but it is by council action. It's a resolution we take to every year. And as long as you say, yes, install the sidewalk, it can go in the program. The other piece of it, of course, is constructability. We find anything over about $1 million, we have a hard time getting contractors to do it. We just don't have the time or the number of contractors in town to be able to do much more than that. So we're somewhat limited by constructability. And then the annual pedestrian crossing. This is a relatively new program that we started last year. Gas tax or arterial is what's used on it. And again, we prioritize along the same, using the same criteria: school routes, arterials and collectors, and then anything with a high pedestrian use. And then other encapsulates a lot of different methods that we get sidewalks built, but I'll run through them. MDT does have projects that they do in our area. We talked about urban routes a little bit earlier. Bench Boulevard and Shiloh Road are both examples of projects that MDT did on our urban routes. Developments, a lot of sidewalks is installed every year through developments. It's one of the larger ways that we get sidewalks installed in the city. And then grants, I added a couple here, the TA grant, the Transportation Alternatives Grant. We did Broadwater, which is what this picture is of. The reason I put this in here is not so much that it's not a sidewalk, it's a trail, but it is a pedestrian route. It is an area we needed to get that walkability in. So it's not a sidewalk, but it's definitely kind of meeting the same need. And then the build grant I put in here as well. There's nothing that says we couldn't go after grants for sidewalks. We have not. Most of the time it's trails that we look at or large road projects. I put CTEP with a cross out here. I had a sad face, I took it off, but CTEP was an amazing project for us. For years, we used CTEP, which is a community transportation enhancement program. I think it's, yeah. And we were allocated a certain amount of money, and many of the sidewalks you see in town were built through CTEP. So that was a great program that we lost several years ago. And then private partnerships, I listed TrailNet here. Again, very rarely on a sidewalk, mostly their trail projects. But I listed it just because it is a funding source we use. So this is really the slide that talks about the funding, which I think was kind of the crux of what the initiative was. Arterial and gas tax, we have $100,000 that we put on our pedestrian improvements. That's the crossing project that I said is relatively new from just last year. It is in the 5-year CIP, funded at $100,000 a year. And we intend to focus that on the school crossings throughout the city. School crossings and arterials. And then the $250,000 in missing sidewalk, that's the match that we put on that. That isn't the property owner assessment. That's the part that we use for corner lots, any kind of areas that we can't assess. Mostly it's a lot of corner lots. And then 250 in accessible ramps. That really isn't a sidewalk project, but it goes toward sidewalk projects. So all the corners in town, we are trying to eventually work through the whole city and get accessible ramps at every corner. And then we have about $5 million a year on road projects. So that can build us quite a bit of sidewalks every year. Again, most of those large projects do have property owner assessments on them. So the second funding source is our property owner assessments. Like I said earlier, there's really no limit per se. We right now have about $500,000 annually on the missing program. That does not include, for instance, this year we'll have 32nd Street West, Wicks Lane, and I think Songbird will probably have some assessments. So that $500,000 does not include the larger road projects, but we have $500,000 on just the missing sidewalks. And that's the variable on the road project. Like I said, those 3 projects will have sidewalks as well. Private partnerships, again, that comes down, I put this as a line item. We could have private partnerships. Mostly we see that on trails more than anything else. And then development. We looked back the last several years and we've seen approximately $600,000 a year on average worth of sidewalks that are going into our developments. And then grants and TIF districts, again, are 2 other funding sources that we could tap. Again, grants very rarely, TIF districts often, given the South Billings Urban Renewal District projects that have been going on. So I wanted to add a couple of other considerations in here. There's an equity piece. Right now, the way it works across the board, no matter how you're doing this, is that property owners pay for what is in the front of their property. If they're residential, they have a corner lot assessment. But other than that, if it's in through development, if it's in through a major road project, if it's a missing sidewalk project, no matter how it goes in, everyone pays for their frontage. With the caveat that in the South Billings area, we are not doing assessments for the projects down there. Development tools, this is a response to one of the questions that I was asked in an email today. When development occurs, we do require sidewalks are built at the time. If for some reason, due to grade, due to the adjacent street, there's a myriad of reasons that we might not be able to physically install them. We either require them to do an SID waiver that says we will put them in at their cost when the time comes, or a cash contribution. We've done that in a few areas where the developer actually gives cash for the cost of the installation of those sidewalks, and then we come along and build it when we put in the road. So we have a few tools there. We do make sure that development pays for their portion of that sidewalk. A couple other things that came up today is the maintenance. Right now, state law does require property owners to maintain their sidewalks. Maintenance is a relatively reactive project for us. We have a hard time even keeping up on the ones that we react to, let alone being proactive for trippers and that sort of thing. I did put on here the multiple programs. I know most of you are familiar with them, but the way that we maintain through the grinding program, the small concrete program, the large program, we have a few different ways that we can address those maintenance issues. And then I just wanted to put on here one more. I talked about the prioritization as we went through this, but I wanted to just talk one more time about the fact that our prioritization on all those programs that we have is school routes, arterials and collectors, and high pedestrian areas. It's what we focus on. Hopefully someday we will be able to focus on more things when we have sidewalks in all these areas. But for now, there's more than enough area for us to be looking at that meet these 3 criteria. The other thing I added on here is our GIS and asset management programs. As you know, we're into both of those, pretty far into developing those programs further. With those programs, we will be looking at inventorying things, inventorying our infrastructure better, and then also maintaining a condition inventory on most of our infrastructure. Right now, we're about half done with the sidewalk inventory, and we hope to get that done here over the next year or so that we know where those missing sidewalk pieces are. And that is what I had. Happy to answer any questions.
Great. Thank you, Debbie. Very informative. Maybe I'll start with where you left off, which is the GIS system. You're doing a lot. We really appreciate that, but it's hard to know what kind of progress we're making. Are we getting rid of most of the problem, or are we just scratching the surface? Are we at X percent? I think I saw something in a report from planning that about 70% of our streets have sidewalks now. Is that true? Is it how that percentage is? In theory, now that we're requiring sidewalks on all new development, this problem of missing sidewalks should get less and less, I would hope. But is it going to be 200 years, 100 years, 50 years, 20 years before we get to that point? Can you comment generally about how we look at the 30,000 foot question?
Thank you, Mayor. Yes, it really comes down to the next phase of this GIS program that we're working on right now. The first phase of that was to develop a plan so that we could figure out how to get all that information in, what was the most important to do, and really develop that plan. And so we have that now. We've kind of quantified what we're lacking. We have a good direction laid out so that we can start doing that. Like I said, what we do in the winter is we inventory a lot of our infrastructure. So when we don't have construction going on, our inspectors are out in the field and they're actually inventorying all of our sidewalk. And so we're hoping to get that. We are working toward getting that GIS system populated. And then it'll be very easy to pull that information out. As you said, new development requires sidewalks. So we're not getting worse. We're definitely getting better, but we have a lot of missing sidewalks throughout the city to get to. I don't have an exact percentage for you.
Okay, thank you. That'd be great. Now questions, Councilmember Purington?
So just a follow up to what the mayor was asking, at least the way I understand it, do you have a timeline for that, or do you still have to wait till you finish with this inventory?
A timeline for how long it would take us to get all the sidewalk done? Mm-hmm. Is that what you're, okay. I really need to know what the inventory is, how many miles of sidewalk and what kind of areas we're looking at. There's a lot of streets in town that I would say we may never put sidewalk in, and I'm sure a lot of you are familiar with them. Some local streets that are dead ends, very low traffic volumes. Some of those we may not get in many, many years. But as soon as we can get this inventory, we intend to put together a plan and show how long it will take us to get that done. We just don't have that yet.
So follow up, Mr. Mayor.
Please.
So David, just for clarification part, could you define trails versus sidewalks in the scope of, our sidewalks kind of go into a trail, or we'll put in a trail versus a sidewalk? So could you just kind of define those terms and what they actually mean to us?
Certainly. Thank you, Councilmember Purington. So when we build an arterial or a collector, in a lot of cases, we look at the pedestrian usage. And most of the time on an arterial, we've standardized on a section that includes a 10-foot trail, the travel lanes, and then a 5-foot sidewalk if it's boulevard on the other side. And you'll see that in every arterial we've done since about 2008, 2007 even. Really, the trail is just a wider multimodal facility. So instead of having the 5-foot walk, you've got the 10-foot where people can cross on bikes, strollers, that kind of thing. So it just provides a more width. Local streets, rarely do we put a trail. I can't think of anything unless we were connecting possibly a school or another trail, but most of the time local streets will have sidewalk on both sides.
And aren't those trails, they're usually asphalt, whereas the sidewalks are, I suppose it's concrete.
That's right. Several years ago, we went back and forth between concrete and asphalt. And at the end of the day, our crews can maintain asphalt in-house very well. And so we've standardized on asphalt. It melts faster in the winter when it snows. We can't get to trails very fast. We're busy plowing roads, and asphalt will melt faster than concrete. So we kind of put several criteria in together, and we've landed on asphalt as our choice for a trail for several reasons.
Thank you.
Thank you. Other questions? Councilmember Tricky?
So thank you for this. I really do appreciate it. You mentioned limits to the how many you can do in a year, and I think you said $1 million is kind of like the largest you can get for in terms of a contractor. What are some of the other factors? And I mean, obviously we could get 5 contractors maybe or something like that, right? But I'm assuming that would require a lot more staff in order to do it and things like that.
Thank you, Councilmember Chiriki. We do have a few criteria that I would say would limit that to some extent. There is not a limitless supply of contractors that we want to do our sidewalk. I mean, we've got a handful of them, but you've got, there's even a limit there as far as how many we could get. So constructability, there is definitely a limit from the construction end of things. The other is the council's direction to us. When we bring resolutions, if we want to put in 5 streets, if we want to get a mile every year, if we want to get a half a mile, I mean, having a goal that the council would like to reach as far as how much sidewalk we do every year would be good. For many years, we've budgeted the same exact amount. We've had $500,000 for assessments and $250,000 for city match. We have not went over that very often. And a lot of that is, as you say, staff time, although we could get more. We have to reassign probably to some extent, but that is constructability. And then also just the direction that we've seen from the council. That's what we put in the CIP. So that's kind of what we've done. If we hear that we want to do a different, more aggressive schedule, we can certainly look at that.
Thank you very much. I guess related to that, or do we have neighborhoods who want to be assessed to put in sidewalk? I don't have the sense that people are beating down our bush or our door wanting to be assessed, but maybe I'm wrong.
So that's one thing I didn't put on here, but SIDs, absolutely. So this year in the Heights, we did Shawnee and Radford Square, and both of those have sidewalks now when we got done with them. And that was at the request of the neighborhood to come in and do that project. We don't get many yeses on the SIDs lately, so we're still working on finding more of those, but there are some neighborhoods that want that, yes.
Other questions for Debbie? Councilmember Brown?
Thanks. Debbie, you said that you extended the kind of the distance that you're looking around schools to a half a mile, right? What was it before?
So before, everything that we've looked at in previous studies really focuses on it right at the school grounds. So you have the crossings, you have the ramps, you have, the sidewalk right in front of the school. We have not extended that out in previous studies to include the actual route that we're walking. So this last study that we did, that we went to every school and we found those routes, that was our first attempt at kind of moving out from the schools and finding an entire route to look at. And then, so the half mile is really an extension of the localized school study that's been done to date.
And is that to have a basis of that's about how far the students would be walking, or is that just an arbitrary number that you kind of said, let's go this far?
I'm going to say it's a little bit arbitrary at this point. If we can get the first half a mile around every school, I think we've made a huge dent in it. If we start looking at a mile, we could have such a huge amount of work that it might be harder to prioritize. So I'd say if we could get that half a mile, we would be doing pretty well at each school. So it's somewhat arbitrary.
Okay, and Mayor, I got a couple more. Can I continue?
Please.
Okay, so what are our options? So we've got routes to schools. Let me back up. So on your map, you're showing where you're kind of giving the school suggestions of the routes we would like them to take, because we kind of got those worked out, right?
Right.
So what do we do? What are our options in those cases where we don't have a good route, where there's sidewalks the whole way? And we know that they're not going to, the property owners are not going to want to do an SID. What are the options? We just pay for it, or do we force SIDs? How does that work?
So yes, in areas where we don't have sidewalk, that's exactly what we're bringing to you in the Missing Sidewalk program. And so we go to each of those areas and we identify the corridors that are right around the schools that don't have sidewalk, and that's in that resolution. And so, yes, it's essentially saying you are being forced to put that sidewalk in. It's not an SID. An SID usually is a neighborhood street where they have more of a choice that they want to do this. The resolution is a state law that allows a municipality to say, this is important to us and you need to do it.
Okay, but they are assessed. The property owners are assessed. Okay. Okay.
With corner lot subsidies, but yes, same way as the Missing Sidewalk program.
Okay. Thank you, Debbie. Thank you, Mayor, for your patience there.
No, not at all. Very valuable. Thank you. Other questions for Debbie on the sidewalk program? Councilmember Shaw?
Thank you.
And Councilmember Neese.
It's just a really quick one. Debbie, when were the arterial fees started? And have they only really increased inflationary wise, or has there ever been a larger jump in trying to raise money that way for any projects like this?
I'm probably going to let Jennifer DeRay jump on here, but I believe 2006, but I hate to say it wrong, so Jen can jump in and answer that.
Yeah, it was created in 2004. First fees were collected in 2005, and we went for a long period where it was not increased at all. And then about 7 or 8 years ago was when we started the inflationary increases. So we really got behind for a while and never got quite caught up to where we needed to be.
Thank you very much. Councilmember Neese.
Thank you, Mayor. Debbie, when we looked at some of these for approval in the past, there seemed to be a discrepancy in how we applied, who pays for what with sidewalk, based upon the internal policy you guys have. I think for instance, on Shawnee, when you put the sidewalks in, didn't the city pay for like 2 feet of the sidewalk, because the SIDs, the city, they only have to pay for 5, and we wanted 7-foot sidewalk, so we had to pay for the 2 foot. I understand that correctly?
Yes, we assess for 5 feet of sidewalk, and that's why we try to install boulevard, is because that is that 5-foot width.
Right, but then when we do like the Missing Sidewalk program, when we do like an Aronson and we do a 7-foot sidewalk, then they pay for the whole 7 feet. Do I understand that correct or not?
No, we had the same assessment throughout. We're being consistent through those.
Okay, so there isn't a discrepancy as far as in the two policies between the Missing Sidewalk program and the SIDs that we put in, and people ask for SIDs. So yes. All it is I guess the issue is that our policy is we want to put 7-foot sidewalks in, and oftentimes we end up picking up 2 foot of the bill because we're doing a curb walk instead of a boulevard walk.
Yes, if we have to go to a curb walk, the decision was made several years ago. We used to have a lot of inconsistencies between these two programs, and we worked to try to put them a little more in step with each other. But yes, the 5 foot, it was decided that 5 foot would be the maximum to be in step with that other program. Yes.
Okay. And Mary, if you don't mind, another quick question. I think was there something in regards to corner lots and one program paid for the one side and the other program didn't. Do I understand that correctly?
That was exactly the way it used to be, but they now match. We have the same assessment. We have the same offset for both of them.
So what is the policy now for corner lots?
So it is address side for both of them. So the property owner pays address side, all of it. And then on the non-address side, the city, if it's residential, the city pays for the non-address side.
Okay. And then on arterials or, for instance, I think one of the properties we were looking at, the lady had already paid for a sidewalk on one side years ago, but her address side was on the other side where we're putting the sidewalk in. Does the city look at doing any kind of exception for that since they already paid for one side of the sidewalk?
We absolutely do. I mean, we want to put these policies in place using, common sense and trying to be fair. Sometimes it's hard to know if that really happened or not. I mean, if we can look back and see where somebody paid the SID when it was in the old policy, we absolutely will look at that and we'll include that information in the resolution that comes to you.
Okay. And do arterials, sorry for Mayor if I keep asking questions, does the arterial have a difference on the corner lot policy?
So the corner lot policy is defined, and I hope I say this right, I'll have to look and just make sure, but the corner lot policy is defined by residential versus commercial industrial. So it doesn't matter what kind of street it's on. If it's residential, you get a corner lot offset. If it's commercial, you don't.
Okay.
So it has more to do with the type of lot.
Okay. Thank you.
Okay, thank you. Other questions? Any other questions for Debbie before we go to public comment for people who call 237-6196? Chris, Kulski, did you turn your...
I guess while we're waiting for any calls to come in, I'd like to clarify, and Debbie, please correct me if I'm wrong. I just want to be clear. The preference is 5 foot detached. That's where the 5 foot city covering, the city covering the 2 feet, if curb attached is what makes the most sense due to topography, due to landscaping, due to things like that. That's where we try to balance that and try to make it as equitable as we can on what the SID is, since it's the homeowner that's paying. So
okay.
We don't prefer 7, but sometimes we do 7 and cover 2 because of what I just described. Thank you.
Thank you. We will open it up then for public comment on this item number 6, the city sidewalk program. Please call that number if you would like to comment. That number again, 237-6196. We ask that you keep your comments to less than 3 minutes. Tell us your name and address at the beginning. And please mute or turn off your screen, the television, or the computer, because our meeting is ahead of what you're hearing. And it'll be very confusing if you're trying to listen to both things. That number again, 237-6196. Any other questions for staff while we wait for phone calls? Councilmember Tricky, or comments?
This is more of a comment. This is really, really helpful. When I was asking about this, what I was thinking is, what do we as council need to be thinking about or doing in order to try to accelerate this program? And I think some of those answers, it sounds to me like we have the tools we need to just basically do it, although additional funding might be nice as we move forward. But it also seems to me that we're probably a year out on actually coming up with real numbers on this and waiting until the GIS system is kind of in place. I mean, I think that's kind of a fair summary. That's kind of like where I'm sitting with it at this point.
Thank you. It does sound like the GIS is critical. Debbie, can you just give us do you have a target date when you could maybe come back with a report on where we're at from 30,000 feet?
I will have to go back and see how far away we are from having the actual sidewalk inventory. I want to be clear, though, we are absolutely full speed ahead as we have been on these sidewalk projects. There's no limit to the number of areas that need sidewalks. So even though we may not be getting the number 1 priority right now, I guarantee we're getting them that are very important. So we're not going to hold on and wait for GIS, we're going to keep at it at whatever rate. We're not going to do the wrong thing for the next few years, I'm sure. So we can keep going at it. But I would say maybe I can give you an idea in a few weeks. I should be able to get a better grasp of what we've got.
Okay, thank you. Denise, do we have anybody who called 237-6196 on item number 6?
Yes, Mayor. I have Christy Drake on the line.
Okay, we'll hear from Christy and any other callers, and we'll look to Councilmember Neese before we conclude. Go ahead.
Are you there?
Hi. Yes, I sure am.
Okay, we are ready to hear your comment. You have 3 minutes.
Okay, thank you.
You're welcome.
Hi, my name is Christy Drake, and I live at 2950 Walden Place. I just moved. And I'm calling on behalf of Billings TrailNet. Of course, I'm the executive director of Billings TrailNet, and I'm just really grateful for this discussion at Billings City Council this evening, because it really needs to be addressed. And we've been working with the Healthy by Design and city engineering on safe routes to school, which are, they can be sidewalks and they can be trails. And I appreciate the engineering department for looking within a half mile of the schools, but actually busing is for kids who live outside of 3 miles from the school. So as Ms. Melling was mentioning in a couple of conversations that we had prior to this, that they are chipping away at this program, at the sidewalk program, and the school program. And when there are children who are waiting for a safe route to school, and it's going to take 10 years to get to it, they'll be out of school by the time they get the actual facility. I want to remind you that there is no trails department at the city, and so Billings TrailNet is being looked at as the funding mechanism for trails, because as you've heard tonight, there isn't really a trail funding source. It's a lot of it is sidewalks. The city of Billings got one build grant, and it got one TA grant over the past about 10 years, and CTEP is gone, and that's what we used to fund sidewalks and trails. So I do hope that you'll find some ways to help our community with active transportation to school, to work, and then for recreation. And those can be two different things. We really owe it to our kids to have safe routes to school and a way to commute from around the town via biking and walking. I know I've got 3 minutes, so that's about all I have, and I'm open to any questions you may have as well. Thank you.
Thank you, Christy.
Thank you. Denise, any other callers to 237-6196?
No, Mayor, that appears to be all of our callers.
Okay, thank you very much. We'll close the public comment period then and conclude with anything else from Councilmember, including Councilmember Neese. You had your hand up.
Thank you, Mayor. I appreciate Christy calling in, and I was wondering about that. I thought it was longer than half mile, 3 miles. I didn't realize it was that long. That's a wide berth that Debbie's probably going, that's a lot of sidewalks probably have to go after now. But my question, I guess, for Debbie is, I was writing some numbers down as you wrote. I think you said you had 500,000 and 250,000, two of the different programs at 750. You thought you could do $1 million. So the council could help you by saying, hey, let's do another 250,000. How much more length of sidewalk does $250,000 get?
I am not going to be able to answer that off the top of my head. It really depends on a couple of things. Some sidewalks are really, really easy to build. They're 5 feet wide. It's nice and flat. There's no retaining walls. And then, for instance, 21st that we did last year was really expensive because it was a retaining wall on every property, really tough. So I will put something together on that, though, and give you an idea. You know, a foot of sidewalk generally, if it's 5 foot wide, costs about $40 per lineal foot. So if you can put that together, I can do some real general numbers and send them to you.
But increasing the budget, by 250,000 would help speed up the program.
Absolutely.
Okay, great. So you have the capacity with that, and so that's good to know. Thank you.
And if you need any more contractors, we'll fire Councilmember Ewald, and he can do that 250,000 or something like that. All right. Anything else from council before we move on to item 7? Don't see it. Okay. Thank you very much, council. Great discussion. Very informative. Item number 7, proposed city council priorities for 2021. Our city administrator, Chris Kupolsky. Chris. Chris, we're not hearing you if you are saying.
There we go.
There you go.
Sorry. Trying to share my screen here. Let me get this out of the way. I can blow it up. Can you see what I'm sharing there?
Yes.
Okay, I'll be brief. This is a report. Certainly not going to go through it. It was in the packet material, but I do want to take a minute to recognize, the work that was done in the previous year. So topic tonight is the draft or proposed 2021 priorities. As the council may recall, the 2020 adopted priorities, they were adopted March 9th. Very much public safety was high on the list, and we're very grateful for the council and for the public support of the public safety mill levy and the support for the Center for Public Safety Management review. And I can tell you, we got 2 really great pieces of information in that regard that came right around this time. Actually, I mentioned the Pelco report here. So a fully statistically valid survey of law enforcement services by our city. Those results are out, and we will determine if I'm going to include them in the weekly this week or present them to you next Monday. And when I say statistically valid, we're talking about the higher level that we talked about earlier. Certain populations representing the cross section of Billings, and a lot of really good data there. So I think you'll have a good many days, if not a week or 2, to really chew on that and see what we got. Also, over the weekend, we received the draft report from the Center for Public Safety Management on law enforcement services. So we haven't gotten the fire yet, but we got law enforcement. Give us about 10 days as a staff, a week to 10 days to go through it. It's about 212 pages. I think that first report, bottom line is I'd like to be in front of you in late February after you've had about a week or 10 days to digest that report, to see what questions you have and what the policy implications of that report are. Project Recode, of course, that was a substantial amount of work, and that was adopted at our previous meeting. The airport terminal reconstruction still remains on our priorities because we do continue to make grant applications. In fact, just today, as I mentioned earlier, we're on the phone with David Turch and Associates. They're talking about the value of your voice support for that project. West End Reservoir, you'd see the updates there. The Park Development Fund, you'll see I've evolved that based on the latest initiative by the council, but a year ago, this was a part of what you adopted. Communications, legislative update, et cetera. So I'm not going to go, I think, any deeper here. You had a chance to read the report and see what's there. So I'm going to stop sharing it and then pull up what we have to kind of discuss this evening. And I'm going to start with this route. So my questions for you this evening, trusting that you had a chance to look at the draft proposals, and I'll pull them up here momentarily. But my first question is, does the council want to proceed with adopting the drafted 2021 city council priorities as presented, or do you have tweaks to them, or do you want a major overhaul and therefore you want to spend several hours on it? If no, how do you want to proceed? Third, should we schedule a policy work session to focus really on priority number one, the public safety, that goes to our, what are we going to do in 2021? I wish it weren't the case, but we did not have a good year last year relative to crime and statistics, as much as we did have a good year of public support. And then lastly, if you're inclined to set aside a focus either way, whether it's the full set of priorities or to focus on public safety, is that something you want me looking at a Monday in late February, early March 1, or a Saturday? So now I'm going to go back kind of up to the top. So that was really my last slide. We've got this: improve the safety of Billings. Subcategories are going to have changed. I'm not going to read this to you. You've had it actually for several weeks. It was in the packet, but I also gave it to you a few weeks back in the weekly. Then you'll notice I then, instead of breaking them into high and medium, I've just kind of consolidated some of them into fewer high priorities. Here's those. We've got the airport project, our west side water treatment plant reservoir, park development, expanding that to not just park development, but analyze all park funding options for both maintenance and operations. And then we're working on the joint planning process relative to the Inner Belt Loop and Skyline Trail. Then the rest of that list that was in your packet, again, of course, participate in this 2021 legislative session. We're continuing to do that daily. We're engaged in that process. That'll go on till mid-April. Define a strategy for cost of service studies. That's something that we've not tackled. One of you just recently sent me an article on Missoula's, digging into whether they should or shouldn't approach impact fees, similar discussions. Then we've got the downtown development. We talked a fair amount about that earlier tonight. And last but certainly not least, actually, a council member and I earlier today went and drove where the bypass is going to come into the east end of the Heights. So with that, I'm going to stop sharing my screen so you can all see one another. If you'd like me to pull any of that back up, happy to do so. And really, I turn it over to you guys. Where do you want to go with 2021 priorities?
Chris, if I could just ask you to clarify the very first question, the question of whether to adopt this priorities list. Is that something you're envisioning we would do rather informally at a work session like tonight and say, yep, we have a motion to have staff continue to focus on these priorities? Or are you thinking something more formal at a future business session?
What we've done the last couple of years is I'll put it on an agenda for you to adopt it in a council meeting. It doesn't have to be that way, but I think it does give it that stronger level of clarity as to where it stands in your guys' mind. So I'd put it on a future business agenda to be determined by you if it's all straightforward consent because you're generally in agreement, or not consent because you want to debate the issues that night.
Okay. But in any event, if there's dissent or changes, we want to hear about them tonight, I'm sure. So, Councilmember Brown.
Thanks, Chris. The only question I have, I don't see the facilities on there. For the city facilities as a priority. I know that that's kind of in the works, but other than that, I like this list. I got to tell you, I don't know that we need to spend all the time debating it again. The same priorities are still the priorities as far as I'm concerned. I don't know how the rest of the council feels, but I think that's a pretty darn good list. And I don't know that we'll even get all of that done in a year, but that's kind of where I'm at on it. But I am curious on the facilities thing, if we could put that as a priority.
Thank you, Councilmember Brown. We could certainly separate that, and I think that's very valid. You will find the criminal justice side underneath of public safety, but you are right. We are looking at the broader overall city hall, though it's probably 2/3 to 3/4 criminal justice that could be separated out for clarity.
Is there anybody who would not want to do that? Or is there a general consensus that we should add something beyond for City Hall expansion besides just the criminal justice? How about just a quick poll? If you think that's a good idea, raise your hand. Okay, you've got a majority, but not unanimity, I guess. But go ahead, other council members. Councilmember Purington, and then Councilmember Browning. There you go.
Okay, sorry. And I didn't vote on your query there, Mr. Mayor, because I didn't quite understand where you were going with it. So, but anyway, the question that I had on this list with number one priority versus high priorities is that some of the things that to me are ongoing, and Debbie just presented about continuing improving the safe routes to school. That's kind of an ongoing project. Roy mentioned something about maybe increasing the budget for that. The airport terminal, the West Side water treatment, some of those things to me are just ongoing. They've been approved, they're ongoing. And I think some of the budgetary things that go along with those, they're kind of already in the hopper. So I think I would like to take some of those things out so we don't muddy the water, if you will, and we really focus on what we need to focus on. The public safety issue with all the different elements there, since we haven't received the analysis of that CPSM, it's hard to say how that's going to fit into what our priorities are. So I would like to see those before we start saying, well, what can we do? You know, I know that there are some that want to put forth another public safety mill levy. Well, we've got to look at all of this before we start. There's, something in here about analyze funding options, because I'm sure that report's going to come back and say we need to do something. So I think that there's some places of this that you could condense and put it in a separate section. And then there's other things that we really need to look at and focus on them and put them in a priority.
Okay, Councilmember.
Happy to.
Or Chris, you want to comment, and then Councilmember Browning?
Thank you. I guess the only one I will point out is Councilmember Purington. You will notice the last sub-bullet under improved safety is the safe routes to school. I also tried to keep the first bullets generic, recognizing you haven't seen the report yet. Maybe we should eliminate support implementation recommendations. You haven't seen them yet, but seek, understanding the policy implications was deliberately meant to be broad, recognizing you may not agree with the policy implications. So thank you.
Okay. Councilor Purington, and then, Councilmember Ronning and Councilmember Shaw.
Thank you. I was going to say something similar to Pam, that having now done this will be the fourth year. I think that there are things that are really heavily staff related, like the West End water treatment plant. I mean, we've made it really clear that's a priority, and unless staff brings us something that City Council really has to weigh in on that, we're just saying, again, it's a priority, and we really don't have anything to discuss on that unless staff brings us something. But I agree. I think if there are things that are really council related, that it is the job of council to set a policy on something, I think those are the things that we need to focus on. And I agree with Pam. If there are things that are just ongoing and they're really staff related at this point, unless there's some type of a policy decision that changes the airport or the West End water treatment, I'm not really sure those need to be heavily discussed in a Saturday work session. But So I would agree with what Pam said, and that would be my encouragement. I really like the idea that City Council dedicate a working session specifically toward public safety. I mean, we have a real crime issue, and we need to get really serious about what we're going to do and really focus on that. And I think if we could be really directed toward that one subject, that's something that I would appreciate and I value, and I would put my vote towards that. So thank you.
Okay, could I make a suggestion, Chris? And what I'm hearing is under that high priority category, I guess it makes me a little nervous just to throw things out that are really high priority, that are so high priority, we all agree we can ignore them because they're such high priority. But I'm wondering if we could just create two categories. One, something like, you can come up with better language, but basically monitoring. So full steam ahead unless something comes off the rail, then get back to us. But monitoring is the concept. And the other is policy decisions required. You know, we truly expect to dig in and make some decisions, but I guess that might be my suggestion. You create two subcategories under high priorities, broken generally into those concepts. But we can talk about that as other council. So Councilmember Shaw, and then Neese and Ewald.
Thank you. Chris, I want to answer the questions that you put before. No, I don't need to hash over these priorities. I think exactly what Councilmembers Spearington and Ronning brought up are great points that I think should be taken into consideration. But for me, exactly what Councilmember Brown said in the beginning, I can't see these substantially changing. But I did want to voice support for spending significant time in a strategy session for public safety. Once we've had time to really digest that information that's going to be coming to us soon from the survey and everything, I would like that to have that be the focus of council strategy session this year, of really understanding that, and then how do we want to move forward. Thanks.
Thank you. Councilmembers Neese and Ewald.
Thank you, Mayor. Chris, you and I talked a little bit about this, and it's changed some, but I think this is a fair representation of your view of the staff or of the council members' priorities. So I think it encapsulates a lot of what we had. We're not really, I guess we're not getting rid of the other priorities because those priorities haven't been completed. Even though we said we completed recode, there's that priority is there to make sure we follow through for at least the next year on that, to make sure that there's hiccups there. So that should be still within this list, I think, as far as, is it high, maybe medium, I don't know, but it is going to be priority that we follow through on that. I agree with the City Hall facility that was brought up. And I also, I guess the first time I read this, I didn't like it, and I'm glad you brought it up when you mentioned about the CPSM Fire Department analysis supporting implementation recommendations. Since I don't even know what they are, you're right. I would say understand, like you said, understand the policy implications. And then the last thing, well, maybe this is the last thing. I'll let someone else talk before I do again, is the strategy for the medical marijuana that's been approved by the state. That I don't know if that's going to have to be moved up into on the public safety. I think it should be addressed sooner than later, because once the legislator figures out what needs to be done, we have to go full steam ahead to figure out what the city is going to do before anything starts just developing on its own. We need to make sure we're in line that. So that would be my recommendation.
Okay, thank you very much, Councilmember Ewald, and then Councilmember Joy.
Thank you. Thank you, Mayor. Chris, did you have on there about Heights Water being a very high priority?
I do not have that listed. I mean, we're now in litigation with them to deal with those issues, but it's not listed there.
Well, I think that should be a very high priority. The West End water plant, the airport, like Mayor Cole says, they need to be monitored in case a glitch comes up so we can keep our gas pedal going on it. Unlike the inner belt loop, which we find out tonight they put the brakes on it for another year. I don't know how many more times they're going to do that. It was supposed to be a 2-lane highway going through there with other 2 lanes set aside for utilities when that came up, and now we're starting onto utilities and putting the road work off until then. So if you let this stuff go, pretty soon it just slips by and it doesn't happen. So we got to keep our foot in on the gas pedal on some of these to make sure they don't get stopped.
Okay. Is there anybody who would object to putting the Heights water? We've got issues of their underpayment. That'd be the top priority, I guess. But okay, I'm not seeing anybody objecting to that, so some thumbs up. Councilmember Joy, you had your hand up.
Thank you, Mayor and Council. I think I would tend to agree that there are some policy implications to the West End water reserve, our redundancy there. There are some issues about P3, whether or not we're going to have public-private partnerships for some of the amenities that that may be built there. That's something we haven't discussed yet. I think there are some policy implications in terms of water usage, how we want to recover costs of services with this West End, and where that comes, where we put in the fact that we need to be thinking about sustainability and resilience, which means really conservation in water use. Those are policy implications that the West End Waters Reservoir, in my mind, is going to bring up. I think those are all policy implications that we should address. I would also like to say the criminal justice facilities and how that might work out. Do we want to sell our city hall if we go on and find more facilities in the soft market that seems to be downtown? Is that something that we would want to do? What are the policy implications there? So I really would like to see these stay as priorities, because I think there's a lot there to dig into in terms of policy. If you're talking about the fire department, we know that study came out saying that our Southwest Corridor and the Heights are both areas where we need improvement. Those have policy implications that I think we should continue to dig into. Thank you.
Thank you. Other comments, again, focusing on the 2 primary questions that Chris posed. One, do you generally like this list, and to what extent would you tweak it? And then second, do you want to get together to talk about in a separate meeting the public safety implications specifically? Councilmember Purington and Councilmember Brown.
Okay, in answer to Chris's questions, I do think it needs to be tweaked. I would agree on a work session. I think a Monday night work session would be fine. I don't know that we need to do a Saturday. One of the things I would suggest, though, Chris, in this participation of the 2021 legislative session that we're going through right now, is that in regards to the legalized marijuana in the city, I don't know that it's even, I think there's some bills that have been, are out there. I haven't seen any of them, but I haven't looked either. And I think the governor made a comment, and of course he doesn't get to say, it is a legislative process, that any taxes that come in for legalized marijuana, that will go towards public safety, addiction treatment, and those things. So whether or not we can weigh in on those, because you haven't mentioned that in anything that we've talked about legislatively, if you are monitoring those, because what's going to happen is that we're going to wind up with sort of the same thing with casinos, how people, what's the separation and all of those things. And so, where are they going to go? So I think there would be very good conversations to have legislatively too.
Amen. Do I hear an amen out there on?
And thank you, if I could,
marijuana legislation?
we are talking about that subject.
Yeah. Councilmember Brown?
Thank you, Mayor. And just a comment here. When we started doing this, the reason we did it is so that the actual staff could prioritize their time. Not necessarily our time. We've got a whole lot more time than the staff do, to be honest with you. We come up, make a policy, and we walk off. There's a lot of stuff that has to happen in the background. And so, taking these things off the list, I think is risky, because just because they're underway doesn't mean there is a staff time still being put to them and a fair amount of staff time being put to them. And I think that's the priority that I think the original intent was anyway. These are the things we want you to put staff time to. Not necessarily these are important to us, because we all have quite a few of those, I think. And if we could include them into all of these, that's great. But I think if we keep in mind, the staff time is the priority kind of list that this was originally created for. If that's not the case, that's fine. But I think that's the assumption I'm running under. And when I run under that assumption, this list is still pretty aggressive for the time that's going to be required by the staff, especially if we go into another public safety levy and everything that goes with that. Not just the public safety levy, but the study and all the different things that go along with that. I agree that would warrant a special session, a Saturday, whatever. I'd be happy to do that. I think that is something that's front and center and kicks us in the teeth every day, and something that we all agree is our priority. Every one of us ran on it. The next session of council members that run are going to run on that. And we kind of got to get that slid to the back burner at some point anyway. So I guess all of this talk is really, if we can just keep in mind that these priorities are the time that the staff are going to have to take, and what do we want them to prioritize as far as hiring, budgets, everything come down to, where we're going to have them utilized. So just kind of an idea of why we kind of started doing this. Thanks.
Okay, thank you. Councilmember Tricky, and then I'm going to try to summarize where we're at as we try to wrap up the discussion and open up for public comment. Councilmember Tricky?
What Councilmember Brown just said, 110%. I would add that it's also the type of thing, it is also the list that we evaluate staff on. So if we take the important projects off of there, I don't think it's fair. The only other thing that I would add, I do like the idea of spending some time just focusing on how we're going to deal with public safety. I think we need to roll up our sleeves and get serious about that. I would also like to see us set aside the one thing that I feel that is missing from this initiative process, and that's the reason why I did what I did last month, is that we're not bringing new ideas into this process. The way that we've done it so far basically makes it really hard for new things to bubble up. And I want us to think about how we want to have new things bubble into this process. Do we talk about it, just set aside some time of doing it? Do we use the council initiative process to bring in new ideas and talk about them? I don't know. But it's something that I think we need to do, especially when we're in a situation where, like we were just talking about with the sidewalks, we're going to need to come up with extra revenue in order to help build all these sidewalks. That's going to have to come from somewhere, and we're going to have to come up with an idea for how to do that. So I'm going 100% behind where we're going in this thing. I just think we need to set aside some time to be thinking creatively about how to fix some of the other problems we're facing. Thank you.
Thank you. Okay, Councilmember Dees.
Thank you, Mayor. I guess one thing I didn't mention, I just want to be careful that what we're doing by adopting this summary of council priorities, where we didn't meet and hash it out and throw our all, like Councilman Chukri said about, putting our ideas in there, find out what's there. This is, I don't want to have us just delegating our responsibilities to our city administrator. I think, like you say, I think he did a good job of taking our priorities from last year that we did spend a lot of time on. Probably some people think more time than we needed, but still, we worked them out. We had them, and I thought they were good priorities. If we adopt these as city council priorities, I would be concerned about that. I would rather see us say, yes, this is a good summary of our ongoing council priorities that really didn't finish up from last year. We're just carrying those over to kind of reorganize them in some fashion to allow staff, like Councilman Brown said, to really spend their time on. And so I just as long as we're not delegating our responsibilities of hashing out what we as a council have as priorities.
Okay, thank you. I guess I'd just comment there that even if whatever we do, we can change midstream, or if we see something during the course of the year, we may want to come back or clarify. Chris, for your benefit, since you are looking for direction here, what I was hearing, and council obviously can comment on this, and then we'll open up for comment. After I'm done talking, just for anybody who's listening, we'll open up for public comment to that number, 237-6196. So be prepared to call that number. But that generally there was a majority who wanted to keep your list, not to make major removals of significant items. I didn't hear anybody objecting. However, if you wanted to make some division between, for lack of a better word, things that we hope are on autopilot versus things that you expect the council to have to weigh in to make policy decisions on, if you want to make that kind of distinction. You heard, I think, and I've got some notes, and other council members did too, I'm sure, of some suggested tweaks, some additions, changing of some of the language. So I would encourage you to go ahead and make those. Ask us if you didn't get all the notes on that. And perhaps you could send that out to the council informally for their reaction before you get it published or gets published. Maybe we can further refine that way. I didn't hear any opposition to having a separate meeting focused on public safety. Heard a lot of support for that. I didn't hear any clear preference for whether that's a Saturday or a work session, although it would depend on the work session about other things that have to be done that are already on the schedule. So if we don't have any time work sessions, we wouldn't have any option except to go to a Saturday. Would be my interpretation of that. So that's how I'm hearing us. So let's formally, and we'll go back to the council before we wrap this up, see if anybody wants to make exception to anything that I said or give further instruction to Chris. But we do have that phone number, 237-6196. Any public comment, please call that number right now. We'll ask you to keep your comments to less than 3 minutes. Tell us your name and address. And please turn off or mute your television or your computer because our meeting is ahead of what you're hearing, and it's very confusing if you try to listen to both. That number again, 237-6196. I did give some notice about that earlier. So Denise, do we have anyone who has called 237-6196?
No, Mayor, I've received no calls.
Okay. We'll go ahead and close the public comment period then on item number 7 and just turn it back to council. Council, are we done with this, or is there anything you'd want to add to what I said as sort of a executive summary there or take away from? Okay. I guess people seem generally satisfied except for Chris Kukulski. No, you're good, Chris? You got...
No, thank you. Here's what I'm going to do. I'm going to put it in the weekly as draft. I'll tweak it based on this feedback. Maybe we'll spend just a few weeks before I put it on an actual agenda action item, see if we may need to make more tweaks. And then if I could, plant one last seed and then I'll get out. So I also mentioned, and I don't think it's for this discussion, but what is our vision for our community? Nobody bid on that a month ago. That's not for this discussion. But I can't help but notice there was a pretty substantial announcement made over the weekend. And I don't think that announcement only affects Detroit. General Motors said they will stop building gas vehicles by 2035. We have 3 refineries in our community. Again, this is much longer term, much bigger picture. Ford has implied the same thing as a much broader conversation at some point in the next year or so. I think we do have to have a broader discussion about that very critical economic component to our community. So that's a different discussion, but I just wanted to kind of make sure we're thinking about that as well, not just our task list that's in front of us in the upcoming months. So thank you.
Thank you very much. That's why I just bought a electric bike, so I can get around while the rest of you are on your feet. All right, well, thank you. That concludes item number 7, brings us to items of general council discussion before public comment on non-agenda items. Councilmember Ewald.
Thank you, Mayor. We talked about this probably about a year ago, and that was sober living houses. And I think it had to do with being above Rimrock Road someplace. Well, now we got one supposedly in the Heights in close proximity to Eagle Cliffs Elementary School. I think Chris sent out a memo or an email stating that this one business in town has 7 of them that are supposed to be limited to 8 people per sober living house, and there's 2 at 13, 1 with 11, 2 with 9, 1 with 7, and 1 with 3. So they're not really paying attention to the rules. I did a little bit of research on it, and there's not much we can do about it because it's federally implemented deal, so you can't change it. They can move in any residential area. There's nothing you can do about it. Makes me wonder what I would like if one of those was next door to me, what it would do to my property value. We spent a whole bunch of time on recode about casinos being close to residences, and I don't know which is worse. And also in my research on it, there was a big discussion about how, because these people are dependent and they're very vulnerable, they're really apt to be human trafficking coming out of these businesses. So we're picking on one entity or one business in the community, and we've got another one that's not only degrading residential property values, they can move right across the street from a grade school, and it's a good source for human trafficking. So it's a bad situation. And the other thing, one thing that I did find in there, and I don't know who okays these houses to be that way, but if they're federally for handicapped people or in, then they have to be ADA compliant. Everybody else has to be ADA compliant. So maybe that would be one of the methods we could use to make these sober houses harder to get stuck in residential neighborhoods if they have to have ramps and all that stuff put in. And at another angle, Airbnbs. This is kind of similar to that. These people are transients. They're there 3 weeks till the money runs out, and then they're gone, or 2 weeks or 2 days. And they're not all family members. They're from totally unrelated. So what can we do about it as a city? Has anybody even thought about it more than since that one on Rimrock, or are we just going to sit back and just let this stuff keep happening?
Okay, comments or questions, Councilmember Brown?
So Frank or Chris or whatever, I guess I'd be curious of, what has been the damage? I mean, are they out there breaking into cars and stealing people and, doing all that? And we have reports of all that, or, I mean, these people do deserve a right to heal and a right to, address their issues. And if they're not out there committing all these crimes that everybody's afraid of, is it just hysteria? And kind of the same thing with the Airbnbs. Generally these are vacationers. They're not, vandalists and, all of that kind of stuff. So I'm just afraid that we're, creating hysteria here and reacting to a problem that doesn't yet exist. So I'd like to see maybe some numbers from somebody. If those areas have seen increased crime or, anything like that. Certainly if it's an issue, I agree, we got to deal with it, but not just because we're afraid that it is. I guess that's my 2 cents.
Thank you. We'll come back to Chris and maybe ask him if, Chris, you know of any data or if anything can be done to collect data on that question. But Councilmember Neese.
Thank you, Mayor. And Frank, I don't know, you were on the email chain that we were talking a little bit about this, but I agree with Councilmember Brown that this, these people have a right and we have an obligation to help them recover. However, if they are causing trouble, I think the residents have a responsibility to notify the police, get the complaints going in, making sure it's there. You're right, they're federally, they are considered a disability, and so they are protected under a lot of the disability reasons, and not so much ADA and things like that, but just as a protected class. So we need to, if we're going to create any kind of policy, it would be to protect that class. So and other states have done it, other communities have done it, with the idea that you're helping to protect the class. Because like you said, some of them, there are some abuses around the country in those type of facilities. And if we create something to help protect those things, then we can actually regulate them in that. So there's been lots of cities. I think I sent you some information about that in different cities, and Chris, you had it as well. So we could maybe take a look into this, but some of it also has to be based upon what the state allows us to do. But some of it we can probably do ourselves. So I think it is a topic we need to look at. But again, let's not look at it on because if we create a policy that we're looking at, hey, how are we going to protect these people from going into these neighborhoods? That will not be supported in any court. We have to look at this as how can we allow these recovery people to be in good facilities, whether it's in neighborhoods or out. It doesn't matter. So.
Okay, I'll just point out our interim city attorney, Gina Dahl, has turned her camera on, and maybe that's because she wanted to comment. Gina, if you did, please do.
Thank you. And yes, if I may, I just wanted to point out that this issue has come up before, and we have issued a memo to council this was back in June of 2019. And so I'm going to resend this to you because I think it's going to answer a lot of the questions that Councilmember Ewald has brought up about these homes. And these sober living homes are operated independently of state regulations. Therefore, they do not fall under the definition of community residential facilities, which can be regulated. These sober living homes are just simply single family dwellings. And so the city can impose the same restrictions as it would any other single family residence, but it would be discriminatory to impose restrictions based on the stereotypes about the persons of this particular class that Councilmember Neese mentions, that in this case, persons with disabilities. So I'm going to send this memo out to you all as a reminder. I think that would be helpful and answer a lot of the questions that have just come up.
Great, thank you very much. Councilmember Purington, or I'm sorry, Chris Kukulski, did you want to comment, Chris?
Yeah, if I could just add a little bit to it. So thank you, Gina, extremely helpful. it is a topic of conversation. So we are talking about this with regulators, and Helena, it was a topic at dinner last week. Why we cannot discriminate. They are protected. However, we also suspect maybe we've created a cottage industry, we being the state of Montana, because the state of Montana is paying the rent on some of this. And again, Billings, we think, but we do need more time for research. We think we may be receiving quite a disproportionate share of this relative to the state. So it is a much broader issue. It's one we've got to do more homework on. Gina's got the land use piece down, the regulatory piece. We're trying to figure out if the Department of Corrections and the administration might also be fueling this in a way that we need to educate ourselves, our community, and the state on ways to improve it. But candidly, it is a topic of conversation, but it's not a highest priority because of time dedicated to other things right now. But we're not ignoring it. We're trying to learn. So thank you.
Thank you very much, Councilor Purington. Councilor Ewald?
So just in addition to that conversation, I had spoken with one of the probation officers last year when that came up with about 2 or 3 of the homes that were above Rimrock. And if they're parolees in those homes, then they have to be pretty well behaved, because if the police are called to those residents because they're misbehaving, they can go back to jail. And I would say the majority of them don't want to do that. I think there was one incident where they were outside and, just being loud and whatever. So I think it is an education piece, Chris, for the community, because I'm sure it is kind of a scary situation for some. And also just, people don't understand it. So, and I've come to have a better understanding of it as well. So anyway, I just, I agree that, people always need a second chance. And for some, this is it. But also, if there are untowardly things going on, then they need to be addressed as well. So thank you.
Thank you. Councilor Ewald and then Councilor Ronning, then we'll try to move on.
Thank you, Mayor. Chris, I think in your memo, you said that Scott Twiddle told you that it was a maximum of 8 people per residence. Is that true?
Councilor Ewald, I don't understand all the regulations. My understanding is 8 is a magic number, but I couldn't define how that is. And yes, according to some of the data that was shared with us, the majority of this one particular ownership were beyond that 8. Like, as you quoted, I think 3 of them were.
2 of them were.
I actually got the numbers right in front of me: 9, 9, 7, 13, 11, 3, and 13. So we've got some work to do to better understand what is going on and if there are violations or not out of fear, but really out of an educated perspective as to how to best handle.
So who has the responsibility to follow up on this to see if they are overfilling? I mean, think about it. You got 13 adults living in a single family house. Is there that many bedrooms in that single family house? I don't know.
I'm assuming, Chris, that'll be something that you can educate us on. There's got to be somebody who follows up on this sort of thing. So I'd like to move on just because the hour is late. Final word, Councilor Purington?
Well, I was just going to say, and Gina may have said it too, it's my understanding it's 2 people per bedroom, if I remember right. So there is a limit. But one thing that I did want to mention, this is good news. We had gotten an email this past week of a gentleman that was complaining about some more defacing of the rocks above Rimrock, I think around 17th Street. And he was just going, what can we do? And, and I just replied back to him some of the things that have happened in the past. I think this past summer, we got a couple of complaints also of, kids going up there and partying and defacing the rocks. Well, I got it, and I just explained to him it's a dance between Parks Department and the police department trying to catch them whenever they can. So I think it was not 2 days later. Oh, I'd also mentioned to him that there was someone that lived up in that area that she said her son would occasionally go up there and clean the rocks off. And anyway, 2 days later, I think it was, this guy wrote back and he said he looked up there and there were young kids up there. They were cleaning up the trash. They were removing the paint from the rocks. And he was just so thrilled. He thought I'd done something. I said, I didn't do anything. But it's just the idea that there are people that are doing good things in Billings without being asked. And so I just wanted to give a shout out to whoever did that. Thank you. And we so appreciate it. And your neighbors appreciated it.
Very good. Thank you. And thank you for calling that to our attention. I apologize. I think, Councilmember Ronnie, you had your hand up at one point. Feel free. You want to follow up on anything there?
I was just going to comment and just share that I appreciated what Roy had to say about a protected class, and also appreciated what Frank had to say. I think it is an important subject for us to talk about, because one of the things that Chris shared is that when businesses like that don't have regulation, and Frank is right, that's when those vulnerable people can be taken advantage of by perhaps business owners that don't have the right intention, but they're in it for some type of monetary value, not human value. And so I appreciate Frank bringing that up, and I think it is a valuable conversation to have, to see what we can do to protect the vulnerable people, because they do deserve to have protections and a safe place to live as they are moving through their sobriety and their recovery. So I appreciated that conversation, and I think it's a good one to have as we go forward. And that's all I wanted to say. Thank you.
Great. Thank you very much. Let's move then to our final item of the evening, which is Councilmember Neese.
Sorry, Mayor, one last thing. I just wanted to address Danny's comment or question about when to bring up new ideas. This discussion time is it. This is the time to bring up the new ideas, to see what people think about them. Like Councilman Ewalt brought up this issue. He wanted to talk about it. I think and Chris is working on it. But yeah, this is the time to bring up the new ideas. So bring them on the work sessions at the council discussion time.
Great. Yeah, and feel free to send us emails in advance so we can kind of know what's coming and chew on them in advance. Okay, final item, public comment on non-agenda items. Please call that if you're listening and you'd like to be heard on anything that was not discussed tonight, not on our agenda. That number 237-6196, 237-6196 for public comment on non-agenda items. You'll have 3 minutes. Please keep your comments as concise as possible. Tell us your name and address, and as you've heard, turn off or mute your screen because our meeting is ahead of what you're hearing. And just listen to Denise's nice voice, who will be talking to you on the other end. If you call 237-6196 for any public comment on an item not on our agenda tonight. Denise, do we have anyone who has called 237-6196?
No, Mayor, I have received no calls.
Okay, thank you, everyone. Not as short as last time, but we got a lot done. Appreciate it. I apologize. We do want to be respectful of people who call, and that really does make it difficult, so we won't. I hadn't quite hit
this call. All right. On the line. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You'll have 3 minutes to give us your comment. May I have your name and address, please?
Sure. Tanya Rome.
Okay.
1921 East Ridge Drive, 59102. And I was just wanting to comment on the sober living homes. We actually have one on East Ridge Drive. And it was a very contentious situation because we had a lot of people that when there's 8 people in a home, there are 8 cars. And what typically happens is they're trying to rehabilitate themselves and get a job and do all those things. So we have 8 cars that have nowhere to park, only 2 in the driveway, and the streets were just packed, and they're actually, you know, and I don't want to be rude about the type of car, but we live in Forest Park, so it's a little bit nicer, and I totally respect people who want to get help and whatnot, but we had a major issue to where people in the neighborhood were wanting to sell their homes to try to get away from this, because it is an ADA situation, and rightly so. So what we did, because we looked into it in our neighborhood, contacted lawyers and whatnot, and they said, yes, they are protected under the ADA. And so we decided that we would try to visit with them in an amicable manner and say, can you please park the cars that can't fit in the driveway around the corner on Colton? So if you go by Colton and 24th and then right on Orange Boulevard, you'll see like 3 or 4 cars that are lined up there. But we have that opportunity to have that. And now there's only 2 cars that are in the driveway. And so, because otherwise it was very much an eyesore, and people were wondering, why are there 8 somewhat beaten down cars in the neighborhood? And so it was a truly almost affecting our property values. So that's how we handled it, because there truly isn't too much you can do, but definitely, like you said, a conversation for the you know, for ongoing houses crop up.
Okay, thank you, Tanya.
Thank you.
You bet.
Great, thank you very much. Denise, any other callers?
No, Mayor, I have no more callers.
Okay, thank you very much. We'll close the public comment period on non-agenda items, and good night, everyone. We are adjourned.